adalah langkah awal untuk mewujudkan cita-cita dan asa. Berani bermimpi berarti berani melangkah untuk terus maju mengejar harapan. Dan disinilah langkah kakiku, harapanku dimulai. Melanjutkan studi serta petualangan demi sebuah mimpi yang telah aku cita-citakan sebelumnya. Ya, di program studi Kebidanan program Diplomatiga Fakultas Ilmu Kesehatan Universitas Yogyakarta.
Program studi Kebidanan program Diplomatiga mempunyai keunggulan dalam asuhan kebidanan komplementer berbasis keluarga.
Aku yakin di sini adalah tempat yang tepat untuk memulai mimpiku. Menjadi seorang bidan profesional yang memiliki standar kompetensi kebidanan. Tersebut, aku dibekali dengan berbagai keterampilan seperti keterampilan dalam praktik kebidanan, promosi kesehatan dan konseling, manajemen dan kepemimpinan serta banyak lagi yang aku dapatkan di sini. Kelak, semua ini menjadi bekal aku untuk melanjutkan karir di berbagai sektor seperti instansi kesehatan pemerintah, rumah sakit dan negeri pertama dan lain-lainnya. Belajarnya sendiri itu sangat penting dan tidak membirakan. Proses belajar yang menyenangkan, diskusi yang nyaman, sekarang dosen menjadikan aku semakin semangat bagi ilmu di sini. Beranilah bermimpi dan melangkah untuk perubahan, menjadi bagian dari kebermanfaatan. Aku percaya mimpi adalah langkah awal untuk mewujudkan cita-cita dan asa. Berani bermimpi berarti berani melangkah untuk terus maju mengejar harapan. Dan disinilah langkah kakiku, harapanku dimulai. Melanjutkan studi serta petualangan demi sebuah mimpi yang telah aku cita-citakan sebelumnya. Ya, di program studi kebidanan program Diploma Tiga Fakultas Ilmu Kesehatan Universitas Respati Yogyakarta.
Program studi kebidanan program Diploma Tiga mempunyai keunggulan dalam asuhan kebidanan komplementer berbasis keluarga.
Aku yakin di sini adalah tempat yang tepat untuk memulai mimpiku. Menjadi seorang bidan profesional yang memiliki standar kompetensi kebidanan. Nah, untuk mendukung kompetensi tersebut, aku dibekali dengan berbagai keterampilan, seperti keterampilan klinis dalam praktik kebidanan, promosi kesehatan dan konseling, manajemen dan kepemimpinan, serta banyak lagi yang aku dapatkan di sini. Kelak, semua ini menjadi bekal aku untuk melanjutkan karir di berbagai sektor, seperti instansi kesehatan pemerintah, rumah sakit dan klinik pratama, dan lainnya. Untuk pengajarnya sendiri tentu sangat kompeten dan tidak perlu diragukan. Proses belajar yang menyenangkan, diskusi yang nyaman, serta keramahan dosen menjadikan aku semakin semangat menimba ilmu di sini.
Iya, Mas.
Beranilah bermimpi dan melangkah untuk perubahan. Menjadi bagian dari kebermanfaatan. Aku percaya mimpi adalah langkah awal untuk mewujudkan cita-cita dan asa. Berani bermimpi berarti berani melangkah untuk terus maju mengejar harapan. Dan disinilah langkah kakiku, harapanku dimulai. Melanjutkan studi serta petualangan demi sebuah mimpi yang telah aku cita-citakan sebelumnya. Ya, di program studi kebidanan program Diploma Tiga Fakultas Ilmu Kesehatan Universitas Respati Yogyakarta.
Program studi kebidanan program Diploma Tiga mempunyai keunggulan dalam asuhan kebidanan komplementer berbasis keluarga.
Aku yakin di sini adalah tempat yang tepat untuk memulai mimpiku. Menjadi seorang bidan profesional yang memiliki standar kompetensi kebidanan. Nah, untuk mendukung kompetensi tersebut, aku dibekali dengan berbagai keterampilan, seperti keterampilan klinis dalam praktik kebidanan, promosi kesehatan dan konseling, manajemen dan kepemimpinan, serta banyak lagi yang aku dapatkan di sini. Kelak, semua ini menjadi bekal aku untuk melanjutkan karir di berbagai sektor, seperti instansi kesehatan pemerintah, rumah sakit dan klinik pratama, dan lainnya. Untuk pengajarnya sendiri tentu sangat kompeten dan tidak perlu diragukan. Proses belajar yang menyenangkan, diskusi yang nyaman, serta keramahan dosen menjadikan aku semakin semangat menimba ilmu di sini. Beranilah bermimpi dan melangkah untuk perubahan, menjadi bagian dari kebermanfaatan.
Bismillahirrahmanirrahim. Good morning. Welcome to all participants of Midwifery Department International Webinar 2022. The webinar is going to start in 5 minutes. Wes, mulai. Mulai kapan? Ini langsung. Good morning. Welcome to all participants of Midwifery Department International Webinar 2023. The webinar is going to start in 5 minutes. To all participants, please be ready and turn on camera. Selamat pagi, salam sejahtera untuk kita semua. Selamat datang untuk seluruh peserta webinar internasional 2023 Prodi Kebidanan Program Diploma Tiga Fakultas Ilmu Kesehatan Universitas Respati Yogyakarta. Webinar akan dimulai 5 menit lagi dan seluruh peserta harap menyiapkan diri. Mengingatkan kembali untuk seluruh peserta agar bisa merename nama sesuai dengan format yang ditentukan oleh panitia. Before we begin, I want to read regulation of participants International Webinar 2023. Number 1, participants can access webinar activities through the Zoom application, which can be accessed from 8 to 12 a.m. with the link provided. Seluruh peserta bisa mengakses webinar melalui Zoom aplikasi atau yang akan dimulai dari jam 8 sampai jam 12. For participants who cannot access the webinar via Zoom application due to several reasons, our committee provides live streaming of YouTube on the channel Kebidanan Program Diploma Tiga UNRIYO. Partisipan yang tidak bisa mengakses webinar melalui Zoom, kami akan menyiarkan melalui live streaming pada YouTube di channel Kebidanan Program Diploma Tiga UNRIYO. Number 3, participants are asked to write the real name on the Zoom or YouTube application, which format for Midwifery student, name _region. For outside of Respati Yogyakarta University, you can write name _country. Peserta yang akan mengajukan pertanyaan, silakan menuliskan nama dengan format untuk mahasiswa kebidanan, nama, kemudian _wilayah, dan untuk dari luar Respati bisa menuliskan nama _negara. Number 4, during the deliver part of participant should mute the microphone. It can be used if needed. Control by host and co-host. Selama pelaksanaan webinar, silakan semua peserta melakukan mute mikrofonnya dan akan dibuka oleh host atau co-host jika diperlukan. Number 5, during Q&A activities, participants who want to ask questions can fill the link that will be provided by committee during the webinar. Selama sesi tanya jawab, peserta bisa menuliskan pertanyaan melalui link yang akan dibagikan oleh panitia selama webinar. Number 6, the requirement for get a certificate are fill the attendance link and evaluation link. The attendance link will be given in the middle of the activity, while the evaluation link will be given simultaneously at the end of the webinar. Untuk mendapatkan sertifikat, peserta harus mengisi presensi yang akan diberikan pada pertengahan kegiatan dan juga mengisi link evaluasi yang akan diberikan di akhir webinar. Excellencies, distinguished guests, participants, speakers, ladies and gentlemen. Honorable Dean of Faculty of Health Science Respati. I repeat. The Honorable Dean of Faculty of Health Science Respati Yogyakarta University, the Honorable all speakers of Midwifery Department International Webinar 2023, Professor Su Chen Kuo, Dr. Meliana Nurul Widyawati, SSIT BDN MKes, Dr. Istri Yuliani, SSIT MSc. The Honorable Head of Study Program, Chief Executive of Midwifery Department International Webinar 2023, Committee and all respectable participants of our international webinar. Thank you for taking the time to be able to attend today's event. Assalamualaikum warahmatullahi wabarakatuh. Good morning. I'm Kenik Sri Wahyuni of Master Ceremony on today's webinar. I'd like to welcome to Midwifery Program Respati Yogyakarta University for the opening ceremony of Midwifery Department International Webinar 2023 with theme Application of Complementary Therapy in Midwifery Care. Ladies and gentlemen, allow me to read the random of today's webinar. Number 1. Singing the National Anthem of Indonesia Raya. Number 2, welcoming speech. Number 3, opening ceremony. Number 4, pemaparan materi pertama oleh Profesor Su Chen Kuo dengan judul Implementation of Complementary Care in Maternal and Child Health. Number 5, pemaparan materi kedua oleh Dr. Meliana Nurul Widyawati, SSIT BDN MKes dengan judul Pain Reduction Technique in Giving Birth with Complementary Care. Number 6, pemaparan materi ketiga oleh Dr. Istri Yuliani, SSIT MSc dengan judul Complementary Business Opportunities in Midwifery Care. And the last, closing atau penutup. Now, we are going to the first event singing National Anthem of Indonesia Raya. All participants may sit well. Thank you. Excellencies participants, ladies and gentlemen, We are going to listen to the welcoming speech delivered by Head of Midwifery Program, Respati Yogyakarta University. Ladies and gentlemen, please welcome Mrs. Almira Kita Novika. Mrs. Almira Kita Novika, time is yours.
Thanks for the time. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. With my great pleasure to welcome all of you to this meaningful international webinar on application of complementary therapy in midwifery care. Before we begin, I want to express our gratitude to the Almighty for bringing us together in good health and spirit. Today, we have the honor of hosting esteemed guests who are experts in their field. Mr. Wahyu Rohdiat Murdiono, the respected Dean of the Faculty of Health Sciences. Professor Shu Chen Kuo, our esteemed guest speaker from the National Taipei University of Nursing and Health Sciences. Dr. Meliana Nurul Widyawati, a lecturer from the Midwifery Department at Poltekkes Ministry of Health Semarang and founder of the Indonesian Holistic Care Association. Dr. Isri Yuliani, a lecturer from the Diploma program in Midwifery at Respati University, Yogyakarta. A warm welcome to all the participants of this international webinar, including student, midwife, and esteemed professional. Your presence and active participation are vital to the success of this event. Today we are diving into the theme application of complementary therapy in midwifery care. The topic covered will include the implementation of complementary care in maternal and child health, pain reduction technique in giving birth with complementary care, and complementary business opportunities in midwifery care. Midwifery services are crucial in providing care to pregnant women, birth mother, newborn, and beyond. The dynamic of midwifery service have led to a resurgence in complementary therapies, combining natural wisdom with conventional medical practice. Complementary therapy is intended to enhance standard midwifery care, create a harmonious synergy between complementary and conventional medical service. Through this international webinar, we aim to deepen our understanding of this application of complementary therapies in midwifery care. We are also excited to announce the evidence-based practice competition, where 17 participants compete under the guidance of Non Takon Damnong RNMNS, who graciously serve as the jury. We appreciate his dedication to this event. Our effort align with the vision of our study program in Diploma and Midwifery, striving to excel in family-based complementary midwifery care by 2038. I am sure that the insight shared by our esteemed speaker will enrich your understanding of the subject matter. Once again, thank you to all participants and organizers for making this international webinar possible. Let us make this event fruitful and enriching everyone. Thank you for your kind attention and active participation. Good morning, and may peace and blessing be upon all of you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Mrs. Almira, to give us wonderful welcoming speech for this event. And last, we are going to listen to the welcoming speech and opening remarks delivered by the Dean of Faculty of Health Science, Respati Yogyakarta University. Ladies and gentlemen, please welcome Mr. Wahyu Rohdiat. Mr. Wahyu Rohdiat, time is yours. Yes.
Okay. Okay. I'm sorry I can't turn on my video because I'm on my way to Solo. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I am delighted to extend a warm and enthusiastic welcome to each one of you to this remarkable health webinar with a special focus on the application of complementary therapy in midwifery care. It is truly an honor to have such a diverse and dedicated audience gathered here today. Today, we have gathered to shine a spotlight on a subject that holds immense potential for enhancing maternal health and well-being. Midwifery care, with its holistic approach, has long been an integral part of supporting mothers and families during pregnancy, childbirth, and postpartum. And now we are embracing an innovative approach by exploring the integration of complementary therapies into midwifery practice. As we embark on this enlightening voyage, we have the privilege of learning from a panel of esteemed experts who are at the forefront of research and practice in this domain. They will be sharing their knowledge, experience, and success stories, showcasing how complementary therapies complement and enrich the conventional midwifery model. Throughout the session, we encourage active participation from each of you.
I'm sorry, Mr. Wahyu.
Yes?
Okay.
Yes, Mr. Ganik?
Yes.
Oh yeah, okay. As we explore the application of complementary therapy in midwifery care, let us remember that we are not only gaining knowledge but also contributing to a broader goal to provide the best possible care and support to expectant mothers and their families. Before we proceed, I would like to express our heartfelt appreciation to all the participants, speakers, sponsors, and partners who have made this event possible. Your unwavering support and dedication to advancing maternal health are truly commendable. Once again, I extend a warm welcome to all of you. Let's embark on this enlightening journey to discover the immense potential of complementary therapy in midwifery care. Thank you, and let's commence this webinar with enthusiasm and curiosity. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Wahyu Rohdiat, to give us wonderful welcoming speech and opening remark for this event. Demikian, acara resmi pembukaan telah dilaksanakan, yang berarti webinar internasional program studi kebidanan program Diploma Tiga Universitas Respati Yogyakarta telah resmi dibuka. Before we begin, to all participants, please fill the link of pre-test was given the committee at group chat, and the time given is 50 minutes.
I had dreamed of becoming a photographer.
My ambition is to become a nurse.
I imagine myself as an IT expert.
Dare to choose a place to initiate your study and start your journey as the beginning of hopes and dreams. Because a bright future comes with hope to strive for. It is definitely not easy to make it happen, but let's reach our goal together. You must have the biggest dream to explore the world, expanding your mind and horizon globally while holding the values of Indonesian cultural roots. collaborating with universities from various countries, going to the highest level bravely, with advanced thought to realize universal vision. For that, we are here to listen, accompany, and bring you to be what you want. Being responsive to the environment, having social empathy, hunting a sense to reach out hope and becoming good human being. Because being an inspiration in kindness is an opportunity to grow and empower others. Spreading kindness is the key to the progress of a society. Making you part of the bright future by mastering technology in various fields, changing the world with knowledge, being creative and innovative, and becoming a person ready to be involved in change. Being open-minded and exploring self-potential to play a role in digital society and ready to work. Every step towards success has a deep meaning and makes you a stronger person. Optimism, confidence, and persistence are the keys to success. Fighting spirit and consistency in facing the challenges and obstacles make us confident in welcoming the future. Your success is our pride and commitment. Our real success is to make you and them smile. Be ready to realize your dreams, because we are great UNRIYO.
Mengingatkan kembali kepada seluruh peserta untuk mengisi pretest di link yang sudah disebarkan di grup chat. Waktunya adalah 15 menit. Oke, time is out. Selanjutnya adalah acara pemaparan materi oleh narasumber yang akan dipandu oleh moderator. Now, without further ado, I turn the time over to moderator to lead. Moderator this event is Mrs. Vika Lili. Mrs. Vika Lili, can you hear my voice? Okay. Mrs. Vika Lili, time is yours.
Okay, thank you, Mrs. Kani. Good morning, ladies and gentlemen, esteemed guests and participants. On behalf of Respati University of Yogyakarta, it's my great honor to welcome you all to the International Seminar on Application of Complementary Therapy in Midwifery Care. My name is Vika, and I'm your host for today's events, and also I would like to greet Professor Suchen Kuo, a distinguished expert in the field of midwifery care from the National Taipei University of Nursing and Health Sciences. Professor Suchen Kuo is a highly accomplished academician and practitioner with an extensive background in midwifery and maternity nursing. Her dedication to research and education has significantly contributed to the advancement of midwifery care, both in Taiwan and international world. Before we move along to the main event, let's take a moment to acknowledge and express our gratitude to Professor Suchen Kuo for being our keynote speaker today. Professor Kuo has an impressive academic journey. She earned her master's degree and a PhD in maternity nursing from the University of Minnesota. She received her Bachelor of Science in Nursing from Kaohsiung Medical College. Interestingly, she also got her bachelor degree in education from Taiwan Provincial Education College. Professor Kuo started the Taiwan Provincial Education College Guidance Department in Educational, and her diploma is in the Taipei Junior College of Nursing, Nurse Midwifery Diploma. Sorry, wait a minute. Over the years, she has served in various academic and administrative roles in her professional career, including as an adjunct professor, dean, and director at the College of Nursing and Graduate Institute of Nurse Midwife at National Taipei University of Nursing and Health Sciences. Today, we have the privilege of learning from Professor Kuo's wealth of knowledge and expertise in midwifery care. Her keynote address will undoubtedly shed light on the application of complementary therapy in midwifery care and inspire us to explore innovative approaches to maternal well-being. Ladies and gentlemen, please join me in giving a warm welcome to Professor Suchen Kuo. Professor Kuo, ni hao lao sir, time is yours. Thank you.
Thank you for your introduction. Okay, thank you. Good morning, everybody. It's my honor to have this speech. Can you hear my voice?
Yes, Lao sir.
Yeah. Okay. Can I share my screen because I cannot because your control not allow me to share the PPT.
Okay, Professor, please commit to share the PPT from Professor Kuo right now. What a minute, Prof?
Yeah, it's not working.
No, you can share screen, Prof.
Okay. It's okay now? Can you see my share the PPT?
Okay, yes. Prof, that's clear.
Okay. Okay, thank you for your help and invite me to have this topic. I want to just share with you about the application of complementary therapies in midwifery care. I just wanted to briefly say something about the development the camp and the trend for this using in our health field or in maternity area. Okay, so based on WHO 2002, a broad set of healthcare practice that are not part of a country's own tradition and are not integrated into the dominant healthcare system. So this is a group of diverse medical and healthcare system practice and the products that are not traditionally considered a part of conventional medicine. Okay, so evolution of CAM. So this was little understood and segregated from conventional healthcare before 1980s. So at that time, that's called alternative or non-conventional or orthodox. In 1990s, so the complementary become popular. And also it's getting used and to be used alongside with the medical care. And then, so when we talk about the CAM, that means therapeutic strategy, or may be used as a diagnostic strategy, and that can be used in isolation or in combination with conventional health care. So from the American, there is a national non-pharmaceuticals, complementary and integrated health. The acronym is NCCIH. That is the federal government agency for scientific research on complementary and integrative health approaches. And this organization have their mission, that is to determine through rigorous scientific investigation the fundamental science, usefulness, and the safety of complementary and integrated health approach and their roles in improving health and health care. So what's the difference between complementary and alternative therapy? So complementary is if a non-mainstream approach is used together with conventional medicine. Alternative is if a non-mainstream approach is used in place of conventional medicine. So you will now, there is a little bit different between complementary and alternative. So most of us use complementary. That means together with conventional medicine and use different kind of approaches. Okay, so the other term is integrative health. Integrative health brings conventional and a complementary approach together in a coordinated way. Also emphasize multimodal interventions, which are two or more interventions such as conventional health care approach and a complementary health approach in various combination with an emphasis on treating the whole person, okay? Rather than, for example, just one organ system. So this is the look at the whole person. So what's the whole person health? So whole person health refers to helping individuals, families, communities, and the population improve and restore their health in multiple interconnected domains: biological, behavior, social, environmental, rather than just treating disease. So this is more broad, more comprehensive for the whole person health. Yeah, and in our nursing and midwifery field, we also emphasize the holistic care. I think you all have been heard this term, okay? Holism is a theory and a philosophy that focus on connection and the interaction between parts of the whole. Using a holistic perspective of living organisms, including humans, are continuous connecting and integrating with their environment. This continual interaction and change means that the body is not the sum of its parts, as in reduction, but that it is a unified dynamic whole. So there's a little big difference. That means holistic view to see a person, and when we use this CAM, why you including CAM in our health care? So holistic care is a holistic philosophy underlying many CAM. A change in any part of the organism will be reflected in other parts. So it's a care practice built on a holistic philosophy. So holistic care provider, for example, midwives, aided CAM to their practice. So each of the alternative list and which body system is affected. So you heard that there are many complementary therapy approaches. For example, feedback, other therapy, massage, okay, acupressure, acupuncture, and hypnosis, so many. And then you will see that will influence different part because we use the holistic view to see how it's in effect on the whole person and our whole health, okay? So complementary actually can be classified by their primary therapeutic input, how the therapy is taken in or delivered, which may be, we can say, have a different kind of category, okay? For example, nutritional, okay, special diet, yeah, and the herbs, and the psychological, for example, mindfulness, physical, for example, massage, spinal manipulation, or combination, such as psychological and physical, or psychological and nutrition, can be both or of, like nutritional, psychological, physical. So that's what, because so many different kind of approaches. So based on this, from this American organization, NCCIH, they have defined like category nutritional, psychological, and physical. And then you will see the nutritional can be like herb or drugs, essential nutrition, food and medicine, and the psychology, mindfulness, psychotherapy, or and the spiritual practice. And then they have the have a combination, okay? Physical can be different kind, like music, dance, yoga, Tai Chi. In Taiwan, it's very popular, Tai Chi, or acupuncture, acupressure, or different kind. So they can have this kind of categorized, okay? So how that in America, the 2012, they have a national health interview survey, and you can understand how it's popular, how the trend is to be used. The most is the natural product of depression, yoga, Tai Chi. Yeah, you can have a basic understanding. But now in their new start survey in 2017, yoga is getting more popular now than 2012. Okay, how it's also popular use in pregnancy. So like for this study in 27, the 62% American pregnant women had advised by physician to utilize some form of CAM. More effective modalities, biofeedback, massage therapy, meditation, and yoga. Okay, here I just wanted to let you know, like in your country, Indonesia, there is a national survey in 2014 to 15 that they ask is about in the past 4 weeks. So 24.4% had used the traditional practitioner and or traditional medicine. 32.9% had used complementary therapy. And the factor were associated with both current use is old age, being a Muslim, resident in an urban area or Java, bigger and healthy, being unhealthy, having a chronic condition, having depression system, experiencing sleep disturbance, having high social support. So this is the data from your country. So you can understand how they choose use the CAM or come from this. So have a higher social or may have they have a psychological or physical problem like sleep disturbance or depressing system. Okay. And then if they have a higher social support system, they will getting more used. Okay. And also the CAM used in midwifery care in Indonesia. There is a study in your suburb city area. Okay, the same authors, main author, the 2017 and the 2023. Okay, they already do like study the pregnant woman, 22 women given ice gel packs. Oh, and then that's have a ice gel compression during active stage. And then the result is the woman report there's labor pain. Okay, and at the same authors group, they study the midwives, 81 midwives. And then the result is times of complementary therapy applied or baby massage, and the spa 30%, oxytocin massage 19%, hypnotherapy 14%, yoga, and in prenatal and postnatal 12%, massage for pregnant women 10%, acupressure 5%, aromatherapy 5%, herbal medicine or traditional herb 5%. Okay, so in the data is also getting that understand or it's getting more popular used in your country. Okay, and this is from the Australian study. That's a 2013 study. This study, the sample is 1,800 Australian pregnant women. So they near half women consulting CAM practitioner, and 52% using CAM products. Okay, and then including like a vitamin or minerals. Okay, and also this study is from Australia. They also, the survey is most is midwives and a few midwife students. Okay, the majority they have discussed over 90% and they recommend self-help camps straight to women with a post-date pregnancy, post-date. Okay, most of midwives feel confident in their knowledge to discuss self-strategy, but slightly less so for camp. The top 5 they discuss acupuncture, acupressure, evening Christmas oil, massage, and hypnobirthing. Okay, if midwives are more likely to discuss strategy if they personally use. Okay, midwives were more likely to recommend the strategy if they use the CAM in their own pregnancy. So you can see the personal experience or influence the midwife to have a discussion with the woman about the CAM. Okay, there is another study in Ghana. Okay, a perfect the result is a perfect opportunity for integration of CAM into the mainstream healthcare system in Ghana to address the shortfalls in knowledge. Evidence-based integration of traditional medical therapy into clinical practice will provide safer, faster, and more effective health care for the underserved and the resource poor, particularly in the rural area. So it's more popular, maybe use the CAM in rural area. Okay, and this study is they ask the woman, the pregnant woman, what's the most reasons they use is improve her health and experience. Felt it beneficial to her baby, previous use. Okay, this is from the pregnant woman. Okay, and this is a survey from the complementary product use in pregnancy and lactation, an examination of the information source. So you will say most is from maybe the family, and then some are from healthcare provider, nurses, midwives, doctors. Okay. So now we moved on midwife promoting using CAM. The demands of an alternative to menstrual midwifery provision has acted as a stimulation of the growth of interest in CAM. A increasing need by women to achieve a less medicalized and a more empowered birth experience was documented as the main driver for the current consumer movement. Midwife reportedly supported the integration of CAM because it promotes normal birth, reduces medical intervention, and results in increased job satisfaction. Okay. Furthermore, midwife aided by CAM is considered to be a strategy adopted by midwife to facilitate the process of placing control away from the medical practitioner and more into the hands of women. There are currently great opportunity to design and deliver CAM service that integrate around women's needs. If CAM is to be formally integrated into midwifery, demand should be captured in and illustrated appropriately. Some therapies can be used effectively without assistance, while others are more effective when used with guidance from practitioners who have particular knowledge and expertise. So many people also use CAM for stress management. Stress reduction techniques are used in all stages of health and illness to promote healing and or manage symptoms. CAM can sometimes be effective in reducing symptoms and enhance quality of life, and the midwife can assist women with this therapy. So for the pregnancy is a stress, and then maybe have some discomfort system. So the midwife can be an important role to suggest for the woman to use CAM. Okay, so the midwife have these two reasons and need to have some knowledge about the CAM. Many women use these types of therapies as outpatients and want to continue their use as much as possible when they become pregnancy, and also until postpartum period. Second, it is common for individuals to retain ethnic healthcare practice, although they erased it in other places. And now they face to use, so they need to have this consultant with the midwife to using the CAM. Okay, so consider for the midwives using CAM. I think this is the information come from this article. You can see from the PPT. Okay, so at first is a training. Midwife must be adequately and appropriately trained to use CAM in their practice. And in addition, requirement may be included the register of midwife as approved to provide a specific therapy, which therapy are approved for use within the unit or which are not. And the need to have a client selection, identify contraindication and precautions, documentation. You need to have the record within normal midwifery or medical notes or separately. And be careful in storage, because like we have different kind of essential oil. And so of substance such as essential oil, beach flower remedies, or equipment such as acupuncture needle or moxa sticks. And the supervision or mentoring of staff using CAM. If this is available, with whom and are there opportunity for depriving? Okay, so this is for your reference. As when the midwife using CAM, they can be need to have a consider this. So CAM or use appropriately can acceptable, is valid, cost effective, is worthy, efficacy and safety. It's a power, because that maybe stress decrease the symptoms and the health and the well-being. Okay, from WHO 2002, there is CAM, and they have this kind. It's the green part is commonly used. Okay, the wrong dot, and then this square is sometimes used, or you can see from this. And then have a Chinese medicine, herbal medicine, yeah, in different kind of approach they use. Acupuncture, pressure, yeah, trainer, and shiatsu, spiritual therapy, okay, exercise or qigong, yoga, relaxation, yeah, okay. That's for you can make more sense. WHO also recommend and have this kind of data, how it's popular be used. So when women respond to labor and pain unique and differently, because I have said I will more focus on the using the CAM in labor period. Okay, so I will talk more about this. And it's also popular use CAM in Taiwan in pregnancy period. They use for acupressure, like for nausea and vomiting, and also have a nutritional food therapy. So they have used different kind of, and some use herbs. So it's about many, and it's also more popular use yoga in pregnancy. Okay, so women respond to labor pain uniquely and differently. So what kind of factors will influence their response? So their severity of pain, their experience, their coping strategies, motivation to endure the pain, cultural evaluation. So when we understand what the factors will influence the response to the labor pain, and then we can understand what kind of factor we can do something as a midwife. Others, you cannot do something. So experience, their past experience, maybe it's difficult, but their coping strategies, you can do something. Is that right? Okay. And how can you increase their motivation to endure the pain? Okay, you can do something. Maybe based on your preparation for their childbirth or for the childbirth education. Okay, so, and how there is perception of the severity of pain. You can do something from the psychological approach, maybe mindfulness or, yeah, so that's all imaginary. That can be do something for influencing their response to the pain. So as a midwife, if you know more different kind of camp approach, you can do something more effective. Because severe labor pain will influence impact on the mother and the fetus. That's what the severe labor pain will disperse the maternal autonomic functions, cause the release of catecholamine, maybe will cause abnormal labor and the fetal distress. That will inhibition of uterine activity. And then we'll have the abnormal intrauterine contractions, maybe cause prolonged labor. Finally, will increase the risk of intrapartum problem or increase the cesarean section or have a fetal distress. So you can see, as a midwife, you can have a good contribution for the woman, the perception, not so have severe labor pain. Okay, labor or pain of labor can be intense. So anxiety, tension, fear make it worse. So when you have more pain, you will have higher fear and then have a higher tension. So that's an adverse cycle. That's not a good result. Okay. So woman needs in labor pain. Women would like to avoid pharmacological or invasive of pain management in labor. Women are interested in complementary therapy to help them manage the pain of labor. So there is a study in 2012, okay, maternal reflection on labor pain in management of infants factor. Oh, that is the study from your country. Okay, so they are because how they management the experience, the negative experience of labor pain, prior knowledge to elevate the pain, anxiety but pain must be faced, desire to handle labor pain, desire to be accompanied, awareness of the mother's needs. Okay, so this is Indonesia women's managed experience. So as a midwife of you can think about this, what you can do something for all this. Okay, goals of labor pain management is a self-effective choice, flexibility, individualization to women's needs, wishes, adequate pain relief, consideration of women's psychosocial needs, prevention of suffering. Prevention of suffering. Okay, so what's the difference between pain and suffering? Okay, pain is unpleasant bodily sensation often associated with real or perceived injury, damage, some illness, or extreme exertion. But suffering is extreme mental or emotional distress. So one can have pain with or without suffering. One can have pain along with satisfaction, enjoyment, or empowerment. So what is your expectation, pain or suffering? Or one can have pain along with satisfaction, enjoyment, or empowerment. So one can suffer with or without pain. Pain becomes suffering when accompanied by ignorance, fear, loneliness, helplessness, insensitive treatment, or unresolved past trauma. Suffering, not pain, can lead to post-traumatic stress disorder after childbirth, PTSD, okay? So suffering is adverse outcome. So then we will talk a little bit about the gate control theory, because we use the CAM, but we want to have the gate control theory is the basic theory for support us use different kind of approach of the CAM. Okay, I think you will understand what's the pen sources for the different kind of stage. For the first stage is a uterine contraction, the dilatation of cervix, pressure in pelvis, stretching of the pelvic ligament and the cartilage, compression of root of lumbosacral pelvis. And the second stage is because of fetal distension, and then or distension of perineum and the vagina, stretching within pelvis. Okay, and then also refer to influence the pain dermatitis. Okay, and so this pain experience depends on the balance of various stimulus reaching one consciousness. Okay, so I think that you are familiar with this. So if we have a different kind of sources of stimulus from the A del fiber and the C fiber, so that will influence our sensation of pain. Okay, so the less pain is felt. Okay, so if we stimulate the big fiber, so it's what our reason why we choose different kind of approaches of the CAM. So the gate to pain can be closed by many non-pharmacological means. So here we all emphasize on non-pharmacological approaches. So we can have first by reducing the painful stimulus coming from the pain receptor. So this can be like a movement or positioning, counter pressure or base. So this can be like you change the woman change the position, not just lay on bed, and I can have a dance. Okay, and a different kind of counter pressure, like the both hands at the iliac joint pressure. Okay, have a. And then the other one is by increasing transmission of innocuous impulse to compete with painful impulse at the level of the dorsal horns. So this can be intradermal water block, TENS, transcutaneous electrical nerve stimulation, acupressure, massage of various kinds, heat, cold, shower, whirlpool. Okay, by increasing descent inhibitory activity in the higher centers, brain, stem, thalamus, and the cortex in the following ways: diminishing or replacing anxiety and the fear of pain, education, stress reduction, reassurance, hypnosis, controlling somatic and autonomic activity, relaxation, visualization, music, hypnosis, modifying the individual reaction to pain, conscious release, guided imagery, attention focusing, distraction, mental or physical activities, patterning, breathing. And also we can, by reducing the painful stimulus come from the pain receptor, movement and the position, pressure and the base. Okay, so based on the previous PPT, I will do some more deeply explanation. So you will see this is our pelvis. I think all of you are familiar with. Okay, from the the this upper view, you can understand the inlet, okay, the pelvic cavity, and then the outlet, okay. So from the lateral side, you will see this is our birth canal, the pelvic cavity. The infant, the fetus must descend and pass this canal, okay, and following this curve, okay. Okay, and then you see why we emphasize more on different kind of position, change the position, and also the influence, the descending of the fetus. Okay, when you see like this way, yeah, the pelvis, the uterus is like this way. So the uterus tears are forward. It contracts in an upright position. There is no persistent to gravity because the fetus wanted to descend. The gravity reclining position. The uterus work against the pull of gravity as it contracts. By standing or kneeling forward, the uterus is helped to do its work with least resistance. Like if the woman stand like this way, and then it's like this way. So this will also good benefit for the fetus to descend like this position. So you will see why the movement or change the position is very important, and for the woman, pregnant woman, and the fetus. So there is a different kind of out of bed the position. So this is a standing. All this you can see that will help for the descending of the fetus and also the gravity. Okay, this is a kneeling. That will decrease all the pressure to the back of the woman. Okay, and this is a sitting. Can be sitting on a birthing ball, different kind of chair, armchair, sitting on the bed, sitting on the floor. Okay. All this you will see the uterus. And this is squatting. Different kind of squatting that also all help the descending of the fetus. And reducing the pain of mothers. Okay, so this is just a more explain about this, and all relieves the back pain and gravity to help babies descend. Okay, 10 position to make labor more comfortable. Walking, standing, sitting, leaning forward, tailor sitting, semi-sitting or semi-reclining, side lying, squatting, hands on the knees, lunging. This is a kind of lunging, okay? And then when you have this kind of position, the outlet is open because of this, your leg like this way, and the pelvis is opening. The outlet is increased, the size. That will help, especially, and will benefit for the descending of fetus. And it is also decrease the pressure on the back. So this is very beneficial for the lower back pain for the labor woman. Lower back pain, decrease the lower back pain. Okay, using the birthing ball, this is larger for comfort and have an anti-slip finish. Can reduce pain and help you feel more comfortable during labor. Ball are round, but some are also in the shape of a peanut. So that's a peanut ball. I think all you familiar with this. So choosing the rice ball, that's what depends on the height of the woman. Okay, how big, how high it is. What choose small ball or bigger one ball. So when you use the pushing ball, it's be careful. Yeah, it's the not it's too small. It's not fit for this woman. So this is needed to be as a 90 angles, and then that's very comfortable to the foot is not stand on the bed, and then maybe can have someone support you, or you can hold the bed. Okay, so that can be used as a different kind of pushing ball, different position, yeah, can sitting, and also the partner can use together with you as using the pushing ball, that different kind of position, and also that was decrease the lower back pain. Okay, and then have a relaxation for the pelvic area, and also increasing, yeah, help the descending of the fetus. Okay, so for like this, it's also like it have a sitting position and then have a squatting, and then you both use the both together. That can be as a good support and comfortable. Okay, and with the partner or the doula or the family members or they can help you as for support, and also do some massage or do counter pressure like this way. Okay, yeah, you can also lean forward, and also can do the pelvic rocking. Yeah, left, right, left, right, or back and forth. So sit on the ball and draw a circle with your pelvis, following the feeling and the guiding of the body, and then feel comfortable. Because this the pelvic movement that will help the descending of the fetus. And also when we understand the relaxation during the pregnancy period increase, that make the four joint or pelvis more relaxing, and it can be enlarged a little bit. So that will have a positive factor for the descending of the fetus. Okay, then that four joint is, I think all of you all know the pubic symphysis. Okay, then the left sacral iliac joint, and then right iliac sacral joint, and then the last one is sacral coccygeal joint. All these four joints will have more release, and they are not fixed. So the relaxation will help them, and then can have a little bit increase the diameter of the pelvis. That's good for the fetus. Also, we can also use like this way, the pushing ball. Yeah, and then the partner can help. Okay, like this and different kind of, yeah. Okay, this or yeah, different kind of pushing ball. And then the peanut ball, yeah, that's a different kind of diameter. Okay, it's also used based on how height of the pregnant woman. Okay, the higher, and then choose a bigger one. Okay, so this is a different kind. If the woman have a special condition, not allowed to get off the bed, the peanut ball sometimes is very benefit for they lie on bed. So they can use as a kind of like this way, lateral side, and then have a good support. And when you do this, this is to open the pelvis. Okay, that's a very perfect, like this way. Okay. Okay, and then have a different kind of birthing position. Yeah, the midwife can do this, and also that's no, that's especially for the second stage. Okay, especially all fours, sometimes very good, or the lateral. Okay, this is a traditional Trendelenburg dichotomy position. That's not good for the pushing for the second stage. Okay. So you see, when you choose this position, yeah, like an elephant. Imagine trying to restrict an elephant to give birth on her back. And same the woman. So when you see, have been seen the elephant giving birth, they all stand. Yeah, the gravity. Okay, this is not good way for up, but the fundal pressure. Fundal pressure. Yeah, but different kind of hurt for the woman. Not good experience like fundal pressure. It's not a good way. Okay, I think you won't don't do this, and there is a danger for uterine rupture. Okay, so here I just wanted to talk more about why we need to change the position and have the upright position. So when you see, if you lie down, yeah, the curve of the pelvis is almost like a S curve, and also kind of pressure on the sacral here, and all increase more is hypotensive syndrome. So if you have an upright position, you will see the forward, and then the curve will be like a C curve. So that's helpful for the descending of the fetus. Okay, when you see sitting like this way, okay, it's also more helpful than lie down. If you have a squatting, when you do the squatting, you see there is no pressure on the lower back. So the outlet, the pelvic outlet is so open wide. So here you say when you adopt the squatting position, the outlet will increase 0.7 to 1.5 centimeter. So it will increase the size of outlet. That will benefit for the fetus, especially for the second stage. Okay. And then if you have a this semi-reclined position like this way, you will have some pressure on the lower back. And then when you like this dichotomy position, you will see all the outlet will have a limitation, and that will have a inhibitor factor for the baby to expel out. You will see, understand here, like this way, like this. So we will understand why the position is so important for the midwife. Okay. Yeah, you see, this is all fours like this, and then they can do this is the counter pressure, and then the partner can support like this. Just sit on the chair, and the woman sit on her legs, and then also have a gravity for the fetus. Yeah. This is just an ancient Peruvian's funeral. Yeah, run show the position. You see this? Who is the center of this picture? Who? I think all you will understand, the woman. And then what's the position? Sitting. Then she has a good supporter. Yes. The supporter. This is a healthcare provider help needed to change, and then like this way, smaller. Okay, so this is the truly woman center, family center. Okay, and there is some pictures when I attended the ICM conference. There is a exhibition. Yeah, like this. You will see this is the table. Or it's not just for dichotomy. This can be like this, almost a semi-sitting position. Yeah. Is this like a toilet? Yeah. And they can have a sitting for the second stage. That's a different kind of traditional. Yeah. So it's good for the woman, and then maybe increase the outlet and shorten the second stage. Okay, now I just wanted to let you understand more about reducing the pain for stimulus come from the pain X receptor counter pressure. That's a beautiful hand. Yeah, this is pressure on knee. And then the woman sitting, the chair not have a feel, okay? Needed to fix the chair. And then sit upright and then press. Can have a good way. And because I always talk about you, the 4 pelvic joint can be a little bit softened, and it can be enlarged a little bit. So this way, the woman will feel, oh, it's almost have a feeling like the increase the pelvic diameter. This is your both hands on the hip joint, okay, iliac hip joint. Okay, based on electrical fetal monitor, this is a pool, the shower, the pool, water immersion. This is a water immersion, water. Use the water, okay. It will make the woman feel more comfortable and relax, especially the warm water. Okay, so this is by increasing transmission of non-givers. Okay, so intradermal water block. Okay, all this I would say something. So what's the intradermal water injection? So this is the injection of 0.1 ml of sterile water using an insulin or tuberculin syringe, and the 4 sites on the lower back, 1 over posterior superior iliac spine, and the 2 other places 3 cm below and 1 cm medial to each of the sites. So this especially treated the back pain. So this is 1 shot injection can actually pain for about 20 to 30 seconds. But as the injection pain fades, so does water lubricant. So you will see what means that injection. Yeah, sterile water injection for location of the lower back. So this is how to choose that. This is the posterior superior iliac spine, and the 3 cm lower and 1 centimeter lower, 1 centimeter then above joint. This one, okay. So this is the how to choose this 4.2 injection, the sterile water. So after the injection, that will be like this way. Okay, and the next one is TENS. So that's a transcutaneous electrical stimulator. So the woman can self-control, yeah, how they feel, and then do they want more voltage or lower. So mild electrical impulses are transmitted through the skin and stimulate the nerve fibers So handle the battery operated device generated electrical impulses and transmitted them via stimulating pads. The woman control the stimulation. They can feel, and they can switch. Okay, control the stimulant. So this is as a way how they works, and sometimes the woman feel it's benefit. Okay, so can use this for lower back.
Excuse me, Professor.
Huh?
Excuse
What?
me, Professor. I'm sorry.
Hi.
You have 10 minutes left.
10 minutes?
Yes, 10
Okay,
minutes.
I will finish this. Thank you for your
Okay, I'm sorry. Thank you, Professor.
Okay, thank you. Okay, so this is acupressure for points and hand, right? And left hand, different kind of way. And also the foot chart. Okay, that's all different. So the large instant for the acupoint. So this is acupressure therapy. Yeah, here we in Chinese we say 合谷 here. Yeah, you can do that. Try to find it this way, and then press. This is for couple seconds for interval, and also the acupressure for the 3 in crossing. So here it can be found 3 finger widest above the inner ankle bone along the back of the tibia. Yeah, here. Yeah. So here, stimulate at this point on both the leg, regulate and the labor by stimulate uterine contraction. So if the first stage, the uterine contraction is not so good, maybe can use this to stimulate it. Okay, and this is for the lower back. Yeah, acupressure for the labor pain. Okay. Yeah, this is for the foot. Yeah, this essential pressure to help pulling the energy down and calm the stress and anxiety of the mother. And also can use as a ball or calms. Apply acupressure to point the hands. That create a distraction and a new focal point for the brain to concentrate on. Okay, this is a massage. Can be hand massage or back massage, shoulder massage, buttock massage, or sacral massage. Can do like this way, and this way. Okay, and then can you have a baseball as a tool for use in the back massage? Okay. This is another way is cold compression. So heat and cold compression, yeah, can be used for relax or decrease the pain. Okay, and then we have another way is hypnosis. Yeah, it's altering your awareness. Okay. So the subconscious come to the front, while your conscious mind take the back, sit for a while. Sometimes the woman feel it's more effective for coping the fear and the anxiety and the pain. Okay, relaxation. So it's a safe use and have a benefit, reducing the labor pain. Okay, and there are many different comfort that can elicit the relaxation response. So music therapy, aromatherapy, massage, it's getting all in water, or breathing, that's all benefit. Or visualization, also another way, okay? Music, listen to music. Can be relieved. Okay, and a guided imagery but this is needed to be trained in the pregnancy period. Okay, so it's a focus on creating harmony between mind and body in order to ease stress. Okay, breathing. Okay, it's also a good way for the woman to have a calm and a relaxed patterning breath, slow breath, like accelerating breath, different kind of breath. Okay, the last part, I just wanted to make a short about the roadmap of labor. So it's like we wanted to have this final end. Okay, we have a different kind of road. So the roadmap is during this road, you have a different kind of activity. Maybe you will have the woman will have a different kind of emotional response. And as a midwife, how do you support the woman or the family emotionally, and supporting also the partner? So like this way, this is made by the Penny Simkin, the American physical therapist, and she used the pain relief method application in the labor and the delivery. Okay, so this is like a roadmap. This is a normal way. You will see there is a different kind of person accompanied. Use a different kind of tool. And this is when the woman have a posterior position for the fetus. And then maybe the lower back pain is severe, they can use different kind of way. And this is a epidural way. So you will see what kind of approach you can use. Okay, so the baby is born and greeting her mother. And then you will see there is another way I wanted to see, because we will use a holistic view to see this, the environment will influence. Okay, so you will see this. I wanted to talk something about the melatonin. The last trimester, the melatonin is getting higher and higher. And during the in labor, the synergize with oxytocin, the melatonin, increase the uterine contraction. So you will see why we wanted to emphasize the light during labor. Okay, that will increase the effective of oxytocin. Okay. So melatonin synergizes oxytocin to enhance labor contraction. So this is let the woman feel more comfortable. So we wanted that you now keep the light low, keep company at the midterm. Yeah. So this is a good way for increase the melatonin. So and then we wanted to increase the oxytocin. So what's the way can make the oxytocin release more? Just make eye contact, have a hug, hold the hands, kiss, play music and dance. So you can teach the partner do something, and also in your service, you can offer some different kind of approaches. So last, I just wanted to show you the environment. So this is a labor room. So if we want to have a woman have a movement and a change position and then out of bed, use better way is change the environment, not put the bed in the central. Okay, and this is the environment of the LDRP. That's in UK. You can see there is a water tank. This is when I visited the Hong Kong. They have like this, and then have this using the birth ball. This can be a handrail, and then the woman can be using the birthing ball. The environment. Okay, the light, use different kind of tool to help them move around, change the position, and keep upright position, and use the water, birthing ball, and the light, the environment. So they need to have a warm privacy, dim comfort, and a safe environment. So the conclusion, encouragement of the high CAM use among pregnant women, obstetrician, general practitioner, and midwives need to inquire with women in their care about the possible CAM use to help promote the communication and a safe, effective, coordinated maternity care. Attention needs to be given to increase information about the many methods to relieve labor pain in formal academic program, professional conference, and in-service education opportunities. So we want the woman can have this way and have a different kind of accompanying person support them, can use different kind of CAM and use different kind of tool to help them have a positive experience. So we want to decrease adrenaline. We want to increase endorphin. Then they them have a muscle relax, energy center to uterus, decrease sensitive awareness of pain. So this is a love hormone. We don't want fight adrenaline. So we want to change the negative cycle to positive cycle to enjoy, accept, relax. So thank you for your attention. Any question about my topic? Thank you for your listening.
Okay, thank you, Professor Ko. I think you have a lot of Indonesian data, right? And I think you really understand of labor woman situation in Indonesia, and you have a lot of experience about labor. And now, the moment you've been waiting for has arrived for the inspiring of presentation from Professor Ko. It's a Q&A session. And for all participants, I invite you to share questions, comments, or views regarding the topic presented by Professor Ko. And please state your name and affiliation in advance when asking a question. Or raise your hand if you want to share a question, or you can kindly share your thought in the chat column. And we have 3 questions, Professor, from the participants. Okay, the first question from Dr. Dewi Saryani from Bali. Good morning, I'm Madi Dewi Saryani from Stikes Advaita Tabanan, Bali. What do you think about the use complementary medicine in the world of health, especially in the midwifery in the future? Professor Ko, you want to...
Yeah, this one, I think it's getting more popular and more have research to examine the effectiveness. And in my PPT, you will see there is a center in America. They almost focus on the study about it to find the effectiveness of the CAM. So I think it's getting popular. So when you see how the category they use, so that means besides on conventional medicine, there is a more range to talk about the complementary therapy, nutrition, physical, psychological, or combine nutrition, psychological, nutrition, physical. Okay, so you will see it's getting more popular. And when you see the many countries, they have this kind of study. Okay, so I think it's getting more popular. And then, yeah, based on your culture, your specific area, maybe you can find some big camp and they can have a study to see how it's effective. Okay. Yeah.
Okay, thank you, Professor. For the second question from Bernadetta Ferawati from Yogyakarta, Respati University, how the application of acupuncture therapy to reduce labor pain on Taiwan? I think in Taiwan, complementary therapy is so famous and familiar in Taiwan.
But in Taiwan, the nurses or midwife can do is acupressure. If you want to be as acupuncture, in Taiwan, basically now it's most is physician. Yeah, and then they need to have a different kind of training and satisfaction. So the midwife do not use acupuncture. We just use acupressure. Okay.
Yes, thank you, Professor. And the last question from Linda. What recent scientific evidence support the use of complementary therapies in midwifery care? And how does the utilization of these therapies help reduce stress and improve health outcomes for pregnant mothers and infants?
Oh, yeah, I think it's getting more and more have a study on the effectiveness of complementary therapy, especially like in pregnancy or intrapartum or baby. So there is a many study infant massage. That also can be as a camp, infant massage. Okay, and all like in pregnancy, like I say in that nutrition. Okay, mindfulness, yoga. Yeah, that's all psychological category on the mindfulness. That's also benefit. There is a many study from different countries. They have evidence to support the effectiveness. Also enable. I just mentioned all that kind of different kind of way to release the stress or decrease the pain. All that have a good result. So you can have that in your country and to try to see how the results is. And also you can do some qualitative study to have the more deeply understand how the woman feel about all different kind of camp. Thank you.
Okay, thank you, Professor. Thank you, Lase, for sharing your valuable insight and experiences with us today that have been truly remarkable and undoubtedly left a lasting impact on all of us. And I want to share about the summary of the topics that we discussed today. Complementary therapies are health practices outside of regular medicine in maternal care. They are becoming more popular for pregnant women looking for alternative ways to manage labor pain. The National Center of Complementary and Integrative Health, or NCCIH, focuses on researching these practices. Holistic care, which considers the whole person, is important in many complementary therapies used by midwives. Women during labor can use non-medicine methods like movement, acupressure, massage, and relaxation techniques to ease pain. These methods work by closing to gate the pain signal and in the body, giving reliefs. Midwives support and encourage the use of complementary therapies to help women have a more natural and empowered birth experience. To do this, midwives need proper training and knowledge of when these therapies are safe to use. Some effective complementary therapies for labor pain include acupuncture, acupressure, and intradermal water blocks. Visualization, hypnosis, music, and guided imagery can also help with relaxation during labor. Pattern breathing can conserve energy and bring a calming effect. Overall, when complementary therapies are integrated into midwifery care, they can improve women's birth experiences and outcomes. And as we come to the end of this enlightening seminar, I want to express my deep gratitude to all the participants, our honored guests, and the organizing committee for making this event a resounding success. We hope that the knowledge gained from this seminar will contribute to the advancement of midwifery care, embracing the application of complementary therapies for the well-being of mother and infant worldwide. I am Vika. As your host, thank you for being a part of this significant event. Have a wonderful day. And Professor Suchenko, Sheshani Lause for your experience, for your sharing material. It's all of benefit for us. And over to you, Mrs. Koenig, as an MC. Time is yours. Thank you.
Okay, thank you for Professor Su Chen Kuo and Mrs. Vikalili for taking the time to attend to our international webinar 2023. Now, we will to give a certificate for Professor Su Chen Kuo, and we hope you can receive it. Okay, the committee. Yes. Wait a moment, please. We will take a picture. Okay. Yes, okay, thank you and see you next event, Professor Su Chen Kuo. Yes. Okay, before we begin next session, make sure you have filed out the pre-test has been dropped in the group chat. Our next speaker is Dr. Meliana Nurul, SSIT PDN MKes, and the moderator is Mrs. Masruro. So, Dr. Meliana Nurul and Mrs. Masruro, time is yours.
Baik, Bu Meliana, kita akan mulai. Dan sebelumnya, Assalamualaikum warahmatullahi wabarakatuh. Kita akan berkenalan dengan beliau terlebih dahulu. Mungkin bisa saya scan untuk CV beliau. My beloved audience, the next topic at International Seminar today, the title is Application Complementary Therapy in Midwifery Care. Baik, akan saya bacakan untuk CV beliau. Beliau adalah seorang dosen, ya, Educational Development Coordinator and Lecturer of Poltekkes Kemenkes Semarang, Owner ICA Institute, Owner Altimam and Baby Spa. Educational background, Senior High School from SMA and Tiga Semarang. Kemudian Diploma of Midwifery Dipkes Semarang, D4 Bidan Pendidik dari UGM Yogyakarta, kemudian Magister di Promosi Kesehatan Universitas Diponegoro Semarang, fokus pada minat kajian Kespro dan HIV/AIDS, Doktor Ilmu Kedokteran Kesehatan di Pasca Sarjana Undip Semarang dan Profesi Bidan di Poltekkes Kemenkes Semarang. Publication, beliau memiliki 20 dokumen yang sudah terpublish di jurnal internasional dengan indeks Scopus, kemudian 152 dokumen yang sudah terpublish di Google Scholar Index, memiliki 44 haki, kemudian 37 buku, dan beliau seorang reviewer maksud saya, dan sudah 12 jurnal yang direview. Dan beliau memiliki prestasi yang sangat luar biasa, yaitu dosen berprestasi nasional Poltekkes Kemenkes RI di tahun 2021. Dan masih banyak sekali CV yang lain yang sangat menggambarkan kompetensi beliau dan juga konsentrasi beliau pada seorang penulis yang sangat mendunia ya, banyak risetnya juga. Kemudian juga beliau sudah menciptakan beberapa alat yang terkait dengan complementary ini, dan kemudian beliau sekarang juga sedang berproses untuk 3 Simple Passion ya, untuk publikasi juga nantinya, ini dalam proses, dan semoga nanti semua yang dikerjakan beliau atau sedang dalam proses tersebut bisa bermanfaat untuk semua dan berhasil dengan baik. Baik, untuk presentasi nanti 60 menit Bu Mel, dan kemudian untuk tanya jawab 15 menit. Oke, Miss Meliana, time is yours. Hello.
Okay, thank you so much for your speech. Can I share screen now?
Okay.
Wait. Wait. Okay, before I start, I will share my CV first because the MC, I think that you cannot share about my CV. Please, I will share it. Can you see my my screen?
Belum.
Not yet.
Okay.
Okay.
I can see that.
Okay, wait. I will introduce myself. My name is Meliana and I'm from Poltekkes Kemenkes Semarang. And I also owner of the IHCA Institute, also Healthy Mom and Baby Care. And this is my educational background. The MC already talked about this. And this is my publications in Scopus. And I have 20 documents. And I also, as a reviewers of 12 journals. This is the journals that I am a reviewers in there. Can you hear my voice? Is it clear for you?
Yes.
Hello?
Yes.
Okay. And this is the my field of research study about holistic midwifery and applied midwifery technology. My study is about the local wisdom, aromatherapy, also the treatment for postpartum, and also the technology about the contractions device or tools to learn to know about the about the contractions. This is Professor Suryono, and this is Teki. Okay, on 2017, I invited by Tiki to to go to the expo at Makassar to explain about my equipments or tools to learn about the contractions of the uterus. This is the tools. Also, I built the tools also how to know about the power of our touch when we want to go a massage. Jadi di sini saya membuat sebuah alat untuk standar kekuatan pijat. Seberapa kuat kita harus memijat pregnant woman or baby, like that. And this is the scale of the smart gloves massage scale for a standard for pregnancy, for a postpartum mother, and for babies. And I also, as a lecture thesis supervisor of applied midwifery master students of postgraduate program for Poltekkes Kemenkes Semarang. This is the result of their thesis. The determination of the nutritional status of children and its recommendations using artificial intelligence-based anthropometry measurements. Jadi Nursita ini membuat sebuah alat untuk mengetahui status nutrisi anak untuk mencegah stunting ya dengan menggunakan kecerdasan buatan. And this is the utilizations temperature stability based on artificial intelligence. Jadi ini juga menggunakan kecerdasan buatan. And it's also this is the EMG tool image with Raspberry on January 2022. I invited as a keynote of International Online Course of Integrated Medicine, the introduction of traditional medicine and its application into healthcare system in Indonesia. I invited by the Mahidol University, Thailand, from the Faculty of Medicine. And last July, I went to Bangkok, I went to Thailand to take international courses of Thai traditional medicine. On February this year, I invited to go to Tokyo by Professor Naoyuki Kubota from Tokyo Metropolitan University. I went there as a special talk of International Symposium on Community-Centric Systems and Local 5G. Here they are with a professor from Malaysia, Taiwan, UK, also from Indonesia and Japan. And this is my talk in there about the human in the loop on the detection of danger signs in pregnancy. And also, I am a midwife. Of course, this is my international certified of pregnancy and also of massage, hypnotherapy, and smart birthing. I learned about the massage in Perth, Aussie, at 2014. And this is my clinic of healthy mom and baby care in Semarang. We already have 5 clinics in Semarang, Salatiga, Blora, Jogja, and Sidoarjo. Okay, I think that's about me. And now we will talk about the application of complementary therapy in midwifery care. Okay. This is my patient in holistic midwifery care. I also a therapist in hypnotherapy, massage therapies. I also give a massage for a baby. This is my patient. I also make a quarantine class in my clinic. Now we will talk about the midwifery holistic care, but before we talk about that, we will discuss about the traditional or holistic or complementary healthcare. What is that? CAM is a sister of a care based on the philosophy and basic concepts of the whole person, so that patients or clients are holistically, culturally related and become more human. In here, we can say that more human. Because we can see the patients from body, mind, and spirit, not only from her body. Okay. This is the WHO. The organizations recommended about the traditional or complementary medicine since 2014 up to 2023. So this year, the WHO will evaluate about the program of the integration of the traditional medicine and medical. Okay. This we can say that WHO has two models of medicine. The first is modern medicine. We can say conventional, allopathic, biomedicine, scientific medicine, or Western medicine. How about the traditional medicine? We can say also complementary, alternative, non-conventional, oriental, holistic, and natural. So it means that traditional medicine is the same with complementary, the same with holistic, the same with natural. It depends on the country. We can say that maybe in Africa, in Asia, America, they call it traditional medicine. How about in here? In here, we can say holistic also. Okay. We can see this is the vibration. We can imagine that our body have vibrations of the electromagnetic. When our thoughts, when our emotions are not in a good way, or perhaps you are in an angry, a negative mind, negative thinking, it can make the others feel what the emotions that we feel. Jadi setiap manusia memiliki emosi, memiliki vibrasi, ya, dan vibrasi ini akan keluar dari tubuh kita dan bisa ditangkap oleh orang di sekitar kita. So, if we as a therapist, kita sebagai seorang terapi, at the time we are angry, pada saat kita sedang marah, please do not do something with your clients. Saat kita sedang marah, jangan sentuh pasien kita. Because our vibrations can ruin. Jadi vibrasi kita itu akan merusak, ya, akan merusak klien kita. So we have to in positive thinking. Okay. Because of what? Because of we need homeostasis. Homeostasis is the balance or stability that the body strives to achieve among these aspects of a person's life by continuous adaptation. We need to make a balance. We need to make a stability. If we are angry, please make a grounding first or emotional release first before we meet our clients. This is why the holistic medicine is crucial to health, because we are humans. Our clients is humans also, and they have body, mind, and spirit. We are not doing something for their body, but also for their mind and for their spirit. So the combination of body, mind, spirit, we call it whole or holistic. So for the medicine, the holistic is crucial. Okay. And holistic is a term derived from the Greek word holes, meaning whole, menyeluruh. Ya. Jadi holistic itu menyeluruh. Cara pandang kita terhadap klien kita itu body, mind, and spirit. Jangan hanya memandang body saja. That means wholesome health. It means complete health. Okay, wait. Sorry, there is something in my laptop, I think. Okay, this is the dimensions of wellness. I'm sure that all of us need this wellness. Wellness in environment, intellectual, physical, occupation, spiritual, social, financial, also emotion. So we can go to the healing. Healing means to be or become whole. It is a state of harmony or balance in the body, mind, and spirit connection. The core principles of holistic care is the first statement, unconditional love, and support are the most powerful healers. We as a midwife, we as a therapist, we have to give our unconditional love to our clients so that we can support them, giving them powerful healers. Jadi kita sebagai seorang bidan, sebagai seorang terapis holistik, tolong ciptakanlah cinta yang tanpa syarat untuk membantu klien kita, untuk membantu pasien-pasien kita. Karena ini adalah support yang paling penting di dalam penyembuhan. Unconditional love and support are the most powerful healers. Okay, this is the modalities of holistic. We can say acupuncture, energy balancing, naturopathy, therapeutic touch, applied kinesiology, exercise, and so on. A lot of modalities of holistic therapy in the world. Here we can say from the complementary and alternative modalities, there are massage therapy, and acupuncture, meditation, journaling. Journaling is also modalities for a holistic therapy. Okay. How about the application of complementary therapy in midwifery care? What is the meaning of holistic midwifery care? This is the application. The application and function of activities that are the responsibility of midwives in providing services to the clients who have needs for problems related to midwifery. But everything that we do is overall needs body, mind, and spirit or soul. We can say here as for the example of holistic midwifery care, like hypnotherapy, massage, prenatal yoga, aromatherapy, and so on. A lot of holistic therapy that we can do. But here we will talk about the aromatherapy oil. And this is the oil that me and my team in IHJA Institute, we make evidence-based practice. After that, before that, we make a formulation of the essential oils, and then we mix with that formula, and then we share it to our patients, our clients. A lot of variations of the oil that we have. This is aromatherapy. We mix about the aroma and therapy. We can say that this is the art of science using scented oils. Okay. As we know that Mr. Rijn Maurits Gattevoss is the father of the aromatherapy, but actually he is a chemistry. From the accident in his lab, his hand is burning, and then he tried to find the liquid near of him, and he tried to put his arms into that liquid, and he felt the pain heal so quickly. And he wonders, what is the liquid? Oh, actually the liquid is from lavender oil. So at that time, he ran his research about the lavender oil as an aromatherapy. Before that, he is a chemist. Jadi dia seorang ahli kimia,
yang dia itu meneliti tentang kimia, bahan-bahan kimia. Dia mengalami kecelakaan di laboratorium. Dia meletakkan tangannya yang terbakar itu ke sebuah bejana yang berisi air. Kemudian lukanya itu cepat sembuh. Nah, dia penasaran apa ini? Ternyata lavender ya. Sejak saat itu dia mulai meneliti tentang aromaterapi until now. And this is about the regulation in Indonesia about the complementary therapy, ya, hypnotherapy, meditation, spiritual healing, yoga, acupuncture, and so on. We can read it from Permenkes 1109 2007. The government already make a regulation about the types of complementary therapy, and this is the regulations for aromatherapy in Indonesia. Permenkes, Minister of Health, yeah, regulations 1205 2004. Okay, and this is about the pregnant mother who feel nausea, vomiting, especially in the first trimester. And we try to use aromatherapy to help her. A lot of evidence-based practice that we can read about this. Okay. Essential oils can also have a profound effect on the memory, mood, and emotion. We can see from the pathway here. This is the electrochemical effects of aromatherapy from the essential oil. We can use the vapor. It will go to the nose, and our nerves or olfactory nerves will catch, and then it will send it to the limbic system, especially in the amygdala. Our memory, our emotion, our learning about the aroma that send from the nerves into the brain, and the emotion will save in the limbic system. Jadi essential oil itu akan masuk, aromanya akan masuk melalui hidung, dan dia akan diteruskan sinyalnya dari sistem saraf hidung menuju ke sistem limbik di otak, dan dia akan tersimpan ya di amigdala terkait dengan kenangan, memori ya, emosi yang tersimpan dari bau yang masuk di dalam hidungnya. For example, like this: when you feel so bad, when you feel so sad, or when you feel so happy about something, and at that time you catch the aroma, and then that aroma will be saved in the limbic system. If at that time you feel sad, so maybe next time when you feel that aroma, you will be sad also. Jadi begini, tatkala bau itu tersimpan di otak kita, menjadi emosi. Misalkan pada saat ibu hamil membawi sesuatu dan dia merasa mual, berarti it means that there is something, ada sesuatu yang dia simpan di sistem limbiknya, emosi sesuatu yang dia simpan. Nah ini maka limbic system connect with the emotion and memory from the vapor, and then from the limbic system the vapor will go to the hypothalamus. Okay. Before that, from the cortex, it will be intellectual process. Jadi setelah dari limbic system, sinyal bau itu akan dikirim ke hipotalamus. Sebelum itu di korteks akan ada proses intelektual. Jadi it means that if you right now, if you are a student or you learn something or you try to make a book or a thesis or dissertation at this time, when you want to focus of something, so you can use aromatherapy of peppermint. Misal pada saat ini ada seorang mahasiswa atau sedang ingin fokus menulis sesuatu, gunakan aromaterapi peppermint ya, because it can cause the intellectual process. Also, aromatherapy, it can effect of a sexual responses. For example, Yasmin, yeah, Melati, Yasmin. Yasmin, when we use it for a postpartum mother, it can help her libido or her sexual responses will be increased, and it will fix her mood. Ya, jadi tatkala aromaterapi melati kita terapkan pada seorang ibu menyusui, ibu postpartum, di mana libidonya itu menurun, maka penggunaan aromaterapi ini bisa meningkatkan libido dan memperbaiki mood. As we know that postpartum women sometimes they feel swing mood. Ya, jadi moodnya itu swing, naik dan turun. Okay. Yasmin also can help the mother to increase the prolactin. Okay. This is the delivery pathways. We can use aromatherapy from liquid, internal oral, yeah, external by topical, and then vapor from inhalations, and then it will go to the muscle tissue or the stomach, small intestine, large intestine, and it will go to the bloodstream. After that, the excretion, it can be from skin, kidneys, and lungs. This is the pathway of aromatherapy. A lot of aromatherapy that we can use here: eucalyptus, kaffir lime, orange, turmeric. Turmeric is from kunyit. Yeah, turmeric is an active ingredients from kunyit. This is the eucalyptus. And this is the lavender. This is the flower of lavenders. Okay. This is eucalyptus. This is peppermint. Avoid during pregnancy. Peppermint, we can use it for students to learn something, but not for a pregnancy. We can avoid it during pregnancy because it can cause the contractions. And then this is the lemongrass. Lemongrass, it kills bacteria and fungal infections. It can calm the nervous system, relieving depression, stress, and nervous exhaustions. It is safe for pregnant women. This is tea tree. This is turmeric. This is basil. During pregnancy, we avoid it. Yeah, we avoid basil during pregnancy. Also, rosemary, we avoid it during pregnancy. Orange, do not use when pregnant. Okay. But we can use neroli. Neroli is the flower of the citrus, bunga dari jeruk. It called neroli. It is safe and ideal to use during pregnancy. It means that on pregnancy, you can avoid the oil from the fruit of the orange, but you can use neroli. Neroli is the flower of the orange. It is safe and ideal to use during pregnancy. Okay, this is marjoram. Avoid it during pregnancy. Avoid it also if you suffer from low blood pressure. Okay. This is good oil, grapefruit oil. This is the celluloid oil. It can help, especially for the woman. Geranium, it is a woman's oil because it has a regulatory action on the hormones secreted by the adrenal cortex. This is ideal for PMT and menopause. PMT is premenstrual PMT. I think like a premenstrual syndrome like that. This is clarified, they not to be used during pregnancy also. Chamomile. Chamomile is safe for use on babies, children, and pets. Cedarwood. Turpentine is the active ingredients. We can avoid it during pregnancy. Ginger, we can use it for the pregnant mother. It can help to avoid the nausea. Pengle or Singiber Kasumunat, it's good for the postpartum woman because it can use for slimming. This is Yasmin, not to be used during pregnancy, but we can use it after delivery a baby or especially for a postpartum woman. Okay, this is the pregnancy and aromatherapy. This is good, but you have to be careful about the use and dosage of the essential oil, because if you not you have to know that essential oils is dangerous. We have to know about the essential oils are best for the pregnant woman or not, because it can cause the miscarriage. Jadi hati-hati penggunaan aromaterapi pada ibu hamil, karena ada beberapa aromaterapi yang harus kita hindari untuk ibu hamil karena akan menyebabkan keguguran. Okay. This is the top 9 essential oils for pregnancy. This is safe for pregnancy: lavender, yang, orange, eucalyptus, bergamot, ginger, lemon, and chamomile. This is the evidence-based practice of the aromatherapy on pregnant women. This is good. Okay. For relaxation, for antidepressant, this is the pregnancy massage oil that I prepare for my clients in my clinic. I make a formula and the dosage also. And this is the aromatherapy for labor: clariceps, lavender, rose, jasmine, and frankincense. And this is the evidence-based practice of the lavender, because it can help the mother to release the pain, to relieve her pain. Okay, this is the meta-analysis of the use of the lavender on labor pain relief. This is good. Okay, this is about postnatal massage oil. I use kananga. Why? Because kananga oil is good for breast mother. Kananga oil kenanga, minyak kenanga, it's good for to help a mother, especially after delivery, because kenanga oil itu bisa membantu ibu postnatal karena dia bisa mengencangkan payudara. Kananga. So we make a formula for the postnatal massage oil, and the composition, the ingredients are kananga, turmeric, fennel, and kaffir. It can give relaxation, and then it can help the breastfeeding of the mother. It can cure the stretch mark and also for the breast. Okay, this is the oil for child. The safe oil: chamomile, lavender, lemongrass, the tree, teal, and eucalyptus. And I make a formulation for a baby who got a common cold. Jadi saya membuat formula pada bayi yang terkena batuk pilek, common cold. Teknik masasnya ada. We have massage technique and also the aromatherapy, especially for a common cold baby. It can we can mix about the turpentine, kajuput, turmeric, and kaffir. Jadi kami membuat formulasi dan sudah evidence-based practice. We do a research about this and we publish it. Yeah, it contains turpentine, kajuput, turmeric, and kaffir, and it's good. Also, problem of stomach. We make the formulation from adas or fennel, peppermint, pepper betel, and kaffir. This is the oil. Okay. The immune booster massage oil also, we make it, the formulations from turmeric, turpentine, and citronella. Citronella is from the red lemongrass. Okay. This is the examples of essential oil used for massage and skincare, for slimming, for calming, relaxing, stimulating, harmonizing. This is me when I blend an aromatherapy oil. Before I blend, I have to have a wudu and then salat and then relax in a good situation. After that, I blend. Jadi sebelum saya itu melakukan blending oil sesuai formula, saya ambil wudu, salat 2 rakaat, baru saya memasukkan oil-oil ini ke dalam botol in a good condition. Okay, And now this is prenatal yoga. This exercise is good for a pregnant mother. We call it prenatal yoga. Prenatal yoga is a type of yoga specifically designed for pregnant women in preparing for a comfortable delivery. It can help mother to prepare her delivery. And here they are the benefits of prenatal yoga. Can maintain your hormonal balance, reduce morning sickness, reduce constipations, improve the immune system, prevent pain during pregnancy also, improve blood circulation, rejuvenate leg muscles, strengthen knees, ankles, and thighs, and relieve symptoms of hip sciatica, commonly felt by pregnant women are caused by baby pressure. This is good for pregnant mother, but it has the contraindications. They are preeclampsia, placenta previa, incompetent cervix, hypertension, and a history of bleeding. It's not. This is the contraindications for the prenatal yoga. And here they are, the evidence-based practice of yoga. Prenatal yoga is good for prepare the delivery because it can reduce the labor pain. This is the evident practice of prenatal exercise. This, if we want to learn about prenatal yoga, here in IJA, in my clinic also, we give it to the mother. Okay, we have a sequence prenatal yoga from the first trimester, like this. This is the pose of the prenatal yoga. And then for the second trimester, this is the pose. And then for the third trimester, this is the pose. In my clinic, in Healthy Mom and Baby Care, we also give prenatal yoga exercise for a pregnant mother. Okay, the next holistic therapy is music therapy. As we know that Mozart effect proven the unborn babies respond best to classical music when compared to other music genre. And here they are, the evidence-based practice of the use of the music therapy of Mozart. 91% of fetus respond to Mozart music rather than other types of music. But it depends on the parents' beliefs. Yeah, we can use Al-Quran also. We can use Salawat also, like that. Okay. Asle Montague said that human beings cannot survive without touch. Okay, it means that touch, massage. We need the massage. All of the humans need a touch, right? So here, the next holistic therapy is prenatal loving massage. I make research about the prenatal massage since 2012. And I make a conclusion that before we do a massage, especially for a mother or baby, we have to relax first. The therapist must be in relaxed condition. We do an emotional cleansing, we do praying, and then after that, we what is that? We try to let the mother to do what we do. Oke, jadi saya melakukan riset sejak tahun 2012 untuk prenatal massage, ya, untuk massage ibu hamil. Kita tidak melakukan massage secara langsung. Jadi ibu datang langsung dimasas. No, not like that. But before that, we have to make an anamnesa. Jadi anamnesa dulu. We test the tension, kita tes dulu tensinya, and then temperature, and then after that we do breathing relaxation. Jadi sebelum dimasas lakukan relaksasi nafas dulu, emotional cleansing, selesaikan semua masalah emosinya dulu, then praying of Allah, berdoa bersama dengan klien, kemudian padukan antara body, mind, and spirit, hadirkan rasa cinta kasih. After that, you can touch the mother. After that, after you are in a good condition, you can touch your client. Inshallah, it will be good for your pregnant mother. Okay, this is the benefits of loving massage for pregnant and also for postpartum mother. But the contraindications of pregnancy mother, we have to learn it. We have to know. There are massage area contraindication from abdominal massage and leg massage, and the contraindication massage conditions. If the client's bleeding, so we avoid to give the pregnancy massage. Fever also, this is the symptoms of the inflammation, so we avoid it. Nausea, diarrhea, high blood pressure, acute pneumonia, infectious disease, diabetes, and cancer. There are contraindications for massage. But we have to learn also about the contraindications in pregnancy massage. In our pregnant mother bodies, there are a lot of points that we have to avoid. For example, like gallbladder 21. It is, if we touch it, it can be, it can stimulate the letdown reflex on and secret prolactin, and also it can trigger contractions and bleeding. Jadi pada ibu hamil kita hindari gallbladder 21, letaknya adalah di bahu di sini. Ini bisa mengakibatkan kontraksi. But at the other side, for the delivery mother, pada ibu yang bersalin, titik ini bisa membantu meningkatkan kontraksi. So it means that if we avoid it when the mother is pregnant, on the other side, we can use it when the mother in delivery. Jadi titik ini kita hindari saat hamil, tapi kita gunakan saat ibu itu bersalin. Okay, like that. Kidney 1, this is located on the vertical line in the middle of the sole of the foot. We avoid it during pregnancy, but we can use it when a delivery of baby because it can help the contractions. Large intestine 4 here, we call it meeting mountains or grid eliminator, located between the thumb and forefinger. It can cause the uterine contractions. We avoid it while pregnancy, but we can use it while delivery a baby. Here, spleen 6, it is called meeting point of the 3 yin leg meridians. It can help contractions while delivery a baby, but avoid it while pregnancy. Also, spleen 10. Spleen 10 points, I usually use it when I got the patients of atonia uteri, because it can stimulate uterine contractions. But if you touch this point while pregnancy, it can cause the bleeding. Okay, liver 3, also avoid during pregnancy. Bladder 67, avoid during pregnancy. Ovary reflex, it can stimulate the uterus, so you can use it when delivery a baby. Next, for loving baby massage. Massage is for pregnancy, for postnatal, and also for baby. It's good for a baby. It can help a baby to relax, increase their weight, increase, it can make a baby smart. It can help for a stunting baby, like that. Yeah, it's good for a baby. Next, we make hypnotherapy. We give the hypnotherapy also in my clinic, like this, because our client, we do not know about our client. Maybe they have the myth, and so it can cause the mother in a stress condition, in the depressions and negative thinking, and it can affect it of her pregnancy and when delivery a baby. Jadi hipnoterapi juga kami terapkan di klinik. Kenapa? Karena pada ibu hamil, pada ibu bersalin sangat dipengaruhi sekali dengan pengalaman, mitos, kepercayaan, dan ketidaknyamanan yang ini akan menyebabkan stres, depresi, dan negative thinking. So, we use hypnotherapy to increase oxytocin. So, it can help the mother. Okay. This, if we use an electroencephalogram, we can see about the brain wave of the client when we try to give when we give hypnotherapy. When our brainwave in a beta, like this, our focus it's more than nine focus. But when we focus in one subject, but while hypnotherapy time, our brainwave decrease into alpha and then into theta. At this time, alpha and theta is a good brainwave for us as a therapist to give the suggestions. It's called hypnotherapy, but avoid decrease up to delta. We avoid kita mencegah sampai delta, because if our client brainwave up to delta, it means they are sleeping in deep sleep. We avoid this. So in hypnotherapy, we use only alpha and theta. We try to help the patients to stay in alpha or theta using hypnotherapy, and this is the proven benefits of hypnobirthing or hypnotherapy. It can less risk of drug side effects for mother and baby, because we avoid the painkillers, and then the response to pain can be reduced, relax, and then the maternity environment becomes more calm and peaceful. Okay, it's good. It's good for delivery room, I think. And next treatment is traditional postpartum treatment. It's good. It's a combination between massage. Okay, wait. Okay, wait. This is good. This is good for combination from this treatment, loving postnatal massage, facial loving touch, loving lactation massage, hypno-breastfeeding, abdomen wrap aromatherapy, traditional herbal steam bath, and traditional herbal compress. In my clinic, we have traditional postpartum treatment. It contains 7 steps or 7 treatment. Okay, the first is loving postnatal treatment. It can help my patients relax. And this is the facial loving massage. Okay. It can help the mother look healthier. Okay. And then loving lactation massage. Yeah. Okay. This is the step for loving lactation massage. This is the technique. Okay. And this is the traditional herbal compress. Okay, this is good. We use herbal compress after massage. We massage the mother first, the postpartum mother. After that, we use the hot steam from traditional herbal ingredients by applying pressure to certain body parts. The benefit? What is the benefit of herbal compress? It can promote blood circulation, reduce swelling, relieve muscle tensions, reduce pain, and prevent breast engorgement. It's good. This is the ingredients from gingiber purpurae, turmeric, white turmeric, and this is, we try to put it in the postpartum woman after massage. We help them with this. And then we can use traditional herbal steam bath. This is the treatment such as sauna. It's the same with sauna during the puerperium or postpartum. But warning, for a mother with heart disease, high blood pressure, and diabetes mellitus, we avoided if the client got this heart disease, high blood pressure, and DM. What about the benefits? The benefits, it can promote blood circulation, reduce muscle tension and fatigue, removes dead skin cells, and breathing. It is good because before we go into the sauna or herbal steam bath, the herb, we can boil the herb in the tools, in the equipment, and then we can inhale from the herb. This is good. Jadi pada saat kita sauna dengan herbal, kita merebus dulu herbal-herbal ini, kemudian nanti uapnya kita menikmati di dalam steam bath like this. And the next treatment is abdomen wrap aromatherapy. This is costume. Jadi we call it pengkung. But it's from cotton. It is good for mother because the skin will. Jadi begini, ini pengkung. We call it in Indonesia, we call it pengkung, but motivate. Ya, tapi ada modifikasi. Kita menggunakan cotton. We use cotton, and it's costume. Jadi tergantung dari klien. For example, the client loves purple colors, so we can prepare it custom. Kita akan membuat pengkung berwarna ungu, like this. Okay, we need 8 up to 10 meters. Okay, kita membutuhkan sekitar 10 meter kain. Okay, and this is the abdomen wrap aromatherapy oil. Before we use pengkung, we put this oil, the contents turmeric, pepper petal, ginger, kaffir lime, and we mix it with the VCO. After that, we put the oil in the abdomen of the mother. After that, we use pengkung. Okay. We make a study also about this, and I present it on the international conference in I don't remember in where, and I've got the best oral speaker at that time. Yeah. Beside the pengkung, we also have a gurita or postpartum treatment abdomen wrap. It's different with pengkung. Okay. This is aromatherapy body wrapping. This is body wrapping or pengkung. Okay. How about the time? Hello.
Yes.
MC, apakah saya masih ada tambahan waktu?
Masih Bu. Silakan.
Okay, I will present about the Midwifery Holistic Laboratorium of Applied Midwifery Study Program of Postgraduate Poltekkes Kemenkes Semarang. Jadi di pasca sarjana, program pasca sarjana Poltekkes Kemenkes Semarang di lantai 2, we have a Midwifery Holistic Laboratorium of Applied Midwifery here. We can see in the second floor. At the second floor. This is the waiting room. It is a room of antenatal and postnatal here. We have a hypnotherapy chair. Okay. I love purple, so I put purple in the laboratory. Here is usually we need a steam bath for sauna. But in second floor, we also need like this. Jadi untuk steam bath, kita membutuhkan sauna, tapi untuk yang di lantai 2, kita hanya pakai kain kerodong seperti ini. Okay, like this. We can open it, and then we can put the herb under the chair. Before that, we boil it. We need the inhale. We need to inhale, put on the chair, and the mother can sit on the chair. Yeah, this is the aromatherapy here. Okay. We try to mix between the holistic and the medical. Okay. We also help the mother for prenatal yoga and Pilates. And I think that's all for my presentations. Thank you.
Okay. Thanks for the great knowledge, Miss Meliana. Luar biasa sekali materinya. The next section is Q&A. Monggo para peserta bisa bertanya dengan menuliskan di chat room. Oh, ini sudah ada pertanyaan, Ibu. Baik, akan saya bacakan untuk pertanyaan pertama dari Mbak Yuni, Yogyakarta. Whether aromatherapy pregnant will give the same effect for everyone? Bu Mel?
Should I answer it parallel or now? One question and directly? Okay. I will answer the questions for number one. Thank you, Miss Yuni from Yogyakarta. Whether aromatherapy pregnancy will give the same effect for everyone? From the evidence-based practice that I read, that I did also from my clients, almost the same, but not everyone can give the same response. So, for the example like this, if we use the lavender. If we use the lavender to help the mother to decrease her pain or to be relaxed, to help the insomnia, something like that, it is the same effect. Lavender can help the mother to release her pain for delivery of baby. It can have the same effect, but not everyone love the aroma. Like, jadi begini, tidak semua orang itu menyukai bau yang sama. Ya, tidak menyukai bau yang sama. Contoh misalkan lavender. Tidak semua orang suka lavender. Tapi lavender itu bisa membantu memberikan relaksasi, efek sama seperti itu. The effect is the same. Depend on the dosage. Like that. But you have to know that a lot of way to make essential oil. Yang harus kita pahami, yang harus kita ketahui adalah ada banyak cara untuk membuat aromaterapi. Ada yang dengan cara cold press, ada yang dengan cara hot di distillation, direbus. Ya, ada yang dengan cara dipres. Ini juga akan mempengaruhi kualitas. So, be careful when you buy the aromatherapy and the cost is very cheap. Ya, hati-hati tatkala Anda beli aromaterapi dan itu sangat murah. We have to aware about that. Ya. Usually, if we buy a cheap aromatherapy, the ingredients inside, it can contain alcohol, and it's not good for our body. Gitu, Miss Yuni. Okay,
terima kasih Bu Meliana. Sedikit pertanyaan terkait dosis ini, Bu. Bagaimana cara kita untuk bisa memberikan dosis yang tepat, Ibu? Berdasarkan apa dan kemudian caranya bagaimana begitu?
Ya, ada pelatihan khusus. Jadi memang saya pelatihannya 6,5 juta 5 hari.
Wow.
Dan itu di situ kita belajar meditation for blending oil, and then how to make a formulation, and how to how to make a dosage. Jadi ada aturan-aturannya bagaimana membuat formula dan dosis. For example like this. Jadi contoh misalnya if we want to make aromatherapy oil, blending aromatherapy oil for children. There are formulation that all of the aromatherapy not more than 20%. Jadi kalau misalnya kita misalkan membuat oil khusus untuk anak, itu ada aturan-aturannya. Misalkan tidak lebih dari 20%. Kemudian untuk ibu hamil seperti itu ada aturannya ya, ada caranya. Jadi tidak asal blending, tidak asal campur oil. Jadi ada oil yang top notes, middle notes, and base notes. Ada oil-oil yang masuk di dalam 3 tahap itu dan maksimal persentasenya berapa. Seperti itu. Ya itu harus ikut pelatihannya ya.
Berarti butuh waktu tertentu untuk belajar ya Bu ya. Tidak semua orang bisa begitu. Ya. Baik, kita selanjutnya di pertanyaan kedua from Miss Wati Magelang. What is the benefit of the aromatherapy for baby with common cold and any contraindication? Monggo Miss.
Yes, thank you. The benefit, thank you Miss Wati from Magelang. The benefit of aromatherapy for baby with common cold, I make a research on 2019. Ada bayi dengan ISPA. Jadi saya membuat riset, tapi sebelumnya saya sudah membuat formulasi dulu. Jadi teknik masas khusus untuk bayi dengan batuk pilek, kemudian oil, juga ingredients-nya sudah kami pelajari dulu. Kemudian kami lakukan riset pada anak dengan ISPA. Jadi anak dengan ISPA sekitar 32 atau 36 responden ya. Kita punya kelompok kontrol dan kelompok perlakuan. Indikator biomarker kita gunakan bakteri Streptococcus aureus. Selain itu juga sama, 2 kelompok itu mendapatkan MTBS, manajemen terpadu balita sakit. Kemudian 1 kelompok kontrol itu tidak kita berikan pijat dan oil common cold. Kemudian untuk yang kelompok intervensi kita berikan oil common cold dan teknik masasnya. Ternyata kesembuhannya lama sakitnya itu lebih cepat. Kemudian kualitas tidurnya meningkat. Kemudian demam, penurunan suhu tubuhnya itu juga sangat berbeda, signifikan antara 2 kelompok. Dan penurunan bakteri aureus, Streptococcus aureus sampai dengan 70%. Itu jadi yang berbicara adalah hasil dari indikator ya, indikator valid dari biomarkernya. Kalau kontraindikasi pada aromaterapi termasuk common cold aromatherapy oil, we cannot use it regularly. We cannot use it regularly. Jadi penggunaan tidak boleh setiap hari. But we can use it only if the baby in a common cold. Penggunaannya hanya pada saat dia batuk pilek, selesai sudah. Jadi memang tidak boleh penggunaan aromaterapi itu setiap hari rutin, tidak. Karena khusus untuk anak atau bayi di bawah 1 tahun, especially for the baby under 1 years old, it can affect it can overstimulates of brain cells. Jadi penggunaan aromaterapi pada anak di bawah 1 tahun itu tidak boleh reguler. Kenapa? Bisa mempengaruhi menstimulasi berlebihan sel otak. Seperti itu. Because essential oil is very strong. Itu sangat kuat. So we have to be wise for using aromatherapy or essential oil for our baby or children. Seperti itu, Miss Wati.
Kalau umurnya lebih dari 1 tahun, berarti sudah lebih longgar untuk pemberian aromaterapi ya, Bu?
Yeah, because in here we say for baby, yeah, we say for baby. So For baby, we have to avoid using aromatherapy every day.
Every day. Okay.
Only if indicate something like that.
Baik. Thanks, Miss Meliana. The next question from Miss Rosa Solo. Are there certain circumstances where complementary measures are not allowed? What kind of circumstance?
Thank you, Miss Rosa from Solo. Yeah, not all of the circumstances we can use holistic therapy or complementary alternative medicine. Not every circumstances. We have to learn, we have to know, we have to understand that our pregnancy mother, that our mother who give a delivery, a baby, or the mother who are in a postnatal period is not in a good condition. Jadi pada saat ibu hamil, ibu bersalin, ibu nifas tidak dalam kondisi yang baik. Not in a good condition here, it means that the first maybe they have an allergy. Dia ada alergi terhadap aromaterapi, with aromaterapi. So we can use it. We cannot use it. Or dalam kondisi yang emergency. In emergency circumstances, we do not need complementary, I think. Complementary, holistic, I think it can use it when you are ready and you talk to the mother, to the client, you discuss it, and the circumstances or the conditions is good. Jadi tidak ada kontraindikasi. For example, I will try to give a pregnancy massage for a mother. Misal saya akan memberikan pijat ibu hamil, but setelah anamnesa ternyata ada riwayat perdarahan, ya, antepartum bleeding. Kemudian kita tanya lagi, ternyata dia ada riwayat juga miscarriage, ya, ada riwayat abortion atau miscarriage, ya. Terus pada saat kita lakukan anamnesa kembali, si ibu ini mengalami perdarahan baru beberapa waktu yang lalu. Ini merupakan kontraindikasi. It's contraindications for pregnancy massage. Second, if you meet mother, pregnancy mother, dia mau massage, ternyata dia anamnesa, ternyata dia DM. Ibu hamil dengan DM juga tidak boleh dimasas. Ya, contohnya seperti itu. Jadi ada kontraindikasi yang memang itu sangat kita hindari sebelum kita memberikan massage, spa ataupun yoga, ya. Ada riwayat perdarahan, jangan berikan yoga. That's for the example. So I think you have to learn something about the holistic therapy until you understand. Jadi pada saat kamu mempelajari holistic therapy, pelajari betul sampai kamu memahami betul, sampai kita paham betul apa indikasi, kontraindikasi, kalau terjadi sesuatu apa yang harus saya lakukan. I think we have to wise as a mother, as a midwife, before giving holistic therapy for our clients. Seperti itu.
Baik, terima kasih Bu Mel. Demikian Bu Rosa atau Mbak Rosa ini di Solo. Terkait dengan pertanyaan nomor 3 tadi Bu, berarti untuk penapisan awal ini bagian dari SOP yang harus dilaksanakan ketika kita melakukan tindakan walaupun itu tindakan komplementer ya.
Misal aromaterapi, berarti tanyakan dulu apakah oil ini alergi, dia alergi nggak dengan oil itu, dibaui dulu, jangan terlalu dekat karena too strong. Kemudian ada ibu hamil, kalau secara teori ini menjawab juga yang nomor 1 itu ya. Ada ibu hamil yang dia justru mual muntahnya hilang kalau bau peppermint gitu. Padahal teorinya peppermint itu bisa mengakibatkan kontraksi. Kenapa? Karena ternyata otak dia itu sudah terbiasa dengan bau itu, gitu, sehingga dengan membawi peppermint efeknya nggak lagi ke kontraksi, tapi dia merasa nyaman. Seperti itu. Oke.
Baik Ibu, sambil menunggu pertanyaan yang lain, ini ada pertanyaan dari saya Bu. Sejauh mana penerimaan terapi komplementer ini di level atau dunia atau di tingkat dunia nggih? Karena kalian lihat bahwa mungkin di sebagian negara belum sepenuhnya mengaplikasikan komplementer ini.
Maaf, mungkin saya Indonesia ya, agar lebih jelas. WHO, Organisasi Kesehatan Dunia, sejak tahun 2013 itu men-launching sebuah rekomendasi. Tadi sudah saya sampaikan di slide saya yang pertama itu. WHO merekomendasikan kepada dunia, ya, kepada dunia, dokumennya ada, bisa dibaca, agar melakukan integrasi antara layanan kesehatan tradisional atau holistik, ataupun kita bilang juga complementary alternative medicine, digabung dengan medical atau medis, layanan medis. Ini digabung. Dan kebijakan itu tertuang di sebuah dokumen. WHO menentukan waktu dari tahun 2014 sampai tahun 2023 kebijakan ini berjalan. Maka negara-negara di dunia itu sudah mulai bersiap untuk melakukan penggabungan ataupun integrasi. Saya ada dokumennya di mana Indonesia itu ternyata sudah memiliki Permenkes yang berkaitan dengan holistik mulai tahun 2005, 2004 bahkan ada sampai dengan tahun ini. Dan pemerintah mulai tahun 2016-an ya itu sudah mengintegrasikan layanan holistik ini ke rumah sakit. Uji coba pilot project-nya pada 12 rumah sakit besar di Indonesia, ya termasuk Sarjito, Sutomo. Terus silakan kalau masuk ke sana nanti ketemu dengan di rumah sakit itu ada nuansa holistiknya. Jadi ada suara musik terapinya, ada hipnoterapinya, ya di waktu saya berkunjung ke Sarjito di Jogja itu ada ruangan khusus hipnoterapi untuk membantu ibu bersalin juga. Ada water birth-nya nggak tahu ya. Itu hypnobirthing. Nah, itu sudah diterapkan. Lalu bagaimana dunia? Masya Allah, sejak tahun 2016 sampai dengan tahun ini kami punya MOU kerjasama dengan Mahidol University. Ya. Nah, kenapa kita pilih Sirirat Hospital berada di bawah Fakultas Kedokteran Mahidol University? Karena Mahidol University itu memiliki fakultas kedokteran yang di dalamnya ada 2 jalur. Jalur yang pertama, Fakultas Kedokteran untuk pembelajaran dokter medis biasa. Yang satunya lagi, Fakultas Kedokteran khusus untuk yang holistik, khusus untuk yang traditional medicine. Dan di Sirirat Hospital itu, rumah sakitnya itu saling berhadapan-hadapan. Nah, pada tahun 2018 sebelum COVID, saya mengantar mahasiswa belajar di sana untuk short course online, short course applied Thai traditional medicine. Saat itu saya bersama-sama dengan dokter dari seluruh dunia. Dokter-dokter itu bukan dokter umum tapi dokter spesialis. Saya tanya, where are you from? I'm from Hawaiian University. I'm from Pennsylvania University. I'm from Oklahoma University. Ada satu dokter yang dari Indonesia. I'm from Indonesia, Mbak Mel. My name is Dr. Madonna. I'm from Makassar. Dia dari rumah sakit dari Makassar yang dikirim belajar di Thailand, di Sirirat Hospital itu. Saya tanya, dokter, sebagai apa? Saya dokter spesialis bedah, dokter spesialis anestesi. Mereka bukan dokter umum, tapi dokter spesialis. Saya tanya, dokter, kok bisa datang ke sini belajar massage bersama kami, belajar spa bersama kami, belajar tentang herba bersama kami? What for? Untuk apa? Saya tanya. Dia bilang, WHO itu sudah mencanangkan penggabungan antara layanan medis dengan layanan tradisional, kesehatan tradisional ataupun komplementer. Itu tahun 2018 dan dia bukan dokter umum, dia dokter spesialis. Dan mereka memang belajar itu dikirim dari rumah sakitnya, dari universitinya untuk belajar. Yang nanti akan mereka terapkan untuk pasien-pasiennya, untuk mengurangi nyeri, untuk memberikan relaksasi, untuk memberikan kenyamanan. Itu yang terjadi. Saya tanya, kenapa kamu memilih Sirat Hospital? Mereka menjawab, Sirat Hospital adalah one of collaborating hospital that WHO choose as a center of traditional medicine. Nah, jadi salah satu center dunia untuk belajar traditional medicine adalah di Sirat Hospital di bawah Fakultas Kedokteran Mahidol University. Jadi kalau kita ke Thailand, kita masuk ke Sirat Hospital, yang memberikan pijatan kepada kita siapa? Dokter. Gitu. Saya tanya, sejak kapan kurikulum kedokteran di Thailand itu dipisah menjadi dua? Ada yang medis, ada yang traditional medicine. Sejak 100 tahun yang lalu. Jadi kita mengejar, saat ini sedang proses dunia itu, warga di dunia itu sedang proses untuk mengarah ke pengintegrasi antara layanan dua ini, seperti itu. Dan yang paling baru saat ini pemerintah Indonesia, Bapak Menteri kita, Pak Menkes, itu sedang menggagas adanya wellness medicine, medical wellness. Arahnya ke sana. Dengan cara apa? Berupaya menggandeng baik itu pihak rumah sakit maupun resort-resort untuk memberikan layanan medical wellness baik untuk tourism maupun untuk kita. Jadi kita orang sehat, ingin tetap sehat, maka kita upayakan dengan medical wellness, dengan spa, dengan massage di resort-resort yang nanti akan kita develop. Jadi ada staf menteri khusus, ya, Prof. Laksono, yang beliau memang ditugaskan untuk menggagas medical wellness di Indonesia. Kita kapan? Ya, tempatnya ada sudah di Bedugul di Bali sudah ada, ya. Kemudian yang akan digarap lagi nanti untuk Jawa Tengah ini ada di Tawangmangu, ada di Guci, seperti itu. Nah, kita kapan?
Baik, luar biasa sekali Bu Dr. Meliana, terima kasih untuk pencerahannya, materi yang luar biasa dan semua pertanyaan sudah terjawab. Sebelum kita tutup di materi kedua ini, saya akan membacakan kesimpulan. The application of complementary services to midwifery therapy, we can carry out it holistically for the welfare of mother and babies. Terima kasih Bu Mel. Mohon maaf segala kekurangan dan saya kembalikan lagi ke moderator, ke MC. Saya akhiri wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for Dr. Meliana Nurul and Mrs. Masrura for taking the time to attend to our international webinar 2023. Now, we will give a certificate for Dr. Meliana Nurul and we hope you can receive it. Okay. Wait a moment, please. We will take a picture, Doctor.
Okay.
Okay. The picture can be Dr. Meliana beside the certificate.
Okay.
Please wait, Dr. Meliana. Okay. Maybe some trouble in my committee, and I'm sorry to it. Thank you, Dr. Mariana, for coming in our webinar international, and see you next event. Thank you.
Thank you for the chance. See you next time. Bye-bye.
Okay.
Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, for the next session, the attendees are welcome of coffee break for 5 minutes. Next speaker session will start probably after coffee break. Just for a reminder for all participants, don't forget, make sure you have food of the pre-test has been dropped in the group chat. Thank you.
Aku percaya mimpi adalah langkah awal untuk mewujudkan cita-cita dan asa. Berani bermimpi berarti berani melangkah untuk terus maju mengejar harapan. Dan disinilah langkah kakiku, harapanku dimulai. Melanjutkan studi serta petualangan demi sebuah mimpi yang telah aku cita-citakan sebelumnya. Ya, di program studi kebidanan program Diploma Tiga Fakultas Ilmu Kesehatan Universitas Respati Yogyakarta.
Program studi kebidanan program Diploma Tiga mempunyai keunggulan dalam asuhan kebidanan komplementer berbasis keluarga.
Aku yakin di sini adalah tempat yang tepat untuk memulai mimpiku. Menjadi seorang bidan profesional yang memiliki standar kompetensi kebidanan. Untuk mendukung kompetensi tersebut, aku dibekali dengan berbagai keterampilan seperti keterampilan klinis dalam praktik kebidanan, promosi kesehatan dan konseling, manajemen dan kepemimpinan, serta banyak lagi yang aku dapatkan di sini. Kelak, semua ini menjadi bekal aku untuk melanjutkan karir di berbagai sektor, seperti instansi kesehatan pemerintah, rumah sakit dan klinik pratama, dan lainnya. Untuk pengajarnya sendiri tentu sangat kompeten dan tidak perlu diragukan. Proses belajar yang menyenangkan, diskusi yang nyaman, serta keramahan dosen menjadikan aku semakin semangat menimba ilmu di sini. Beranilah bermimpi dan melangkah untuk perubahan, menjadi bagian dari kebermanfaatan.
Okay, ladies and gentlemen, the next session is going to start. Please be ready. Good morning, Excellencies, participants, ladies and gentlemen. Welcome back to Midwifery Department International Webinar 2023 with me, Kenik Sriwahyuni, as the Master of Ceremony on today's event. For the next session, we will have the last speakers. The Honorable Dr. Istri Yuliani, SSIT MSc, and the moderator this event is Mrs. Eko Mindarsi, SSIT MKes. Time is yours.
Cek.
Thank you, Ms. Keni. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen who are participants in international webinar. I hope you are always healthy and happy and always enthusiastic. I'm Eko Mindarsi. We'll get season 3 this morning on complementary business opportunities in midwifery care. Material on business opportunities for complementary midwifery service is quite important and interesting for you to follow, especially for all those who are just entering the business world in the complementary sector. Therefore, it is hoped that all participants can take part in this webinar as well as possible. All right, ladies and gentlemen, I will get this evening using bahasa.
Saya Eko Mindarse yang akan memandu jalannya sesi 3 di siang hari ini tentang Complementary Business Opportunities in Midwifery Care. Materi tentang peluang bisnis pelayanan kebidanan komplementer cukup penting dan sangat menarik untuk Bapak Ibu ikuti, terutama untuk semua yang baru memasuki dunia usaha dalam bidang komplementer. Oleh sebab itulah diharapkan kepada seluruh peserta dapat mengikuti webinar ini dengan sebaik-baiknya. Pada kesempatan kali ini mengambil tema tentang peluang bisnis pelayanan kebidanan komplementer. Baik, tanpa berlama-lama saya akan perkenalkan terlebih dahulu narasumber kita. Beliau adalah Dr. Istri Yuliani, SSIT MSc. Beliau lahir di Kulon Progo 69 tahun yang lalu dan dengan riwayat pendidikan sekolah bidan, kemudian D3, D4, kemudian program pembentukan kemampuan mengajar dan S2 mengajar Magister Hukum Kesehatan, S3 Penyuluhan Pembangunan Pemberdayaan Masyarakat, minat promosi kesehatan dengan riwayat pekerjaan sangat banyak sekali, baik itu di puskesmas maupun di rumah sakit. Kemudian juga sebagai staf kesehatan reproduksi di Dinas Kesehatan Kabupaten Sleman, serta saat ini sebagai dosen Prodi Kebidanan program Diploma Tiga. Kemudian beliau juga bidan praktik mandiri dari tahun 91 sampai sekarang. Dan dengan riwayat organisasi beliau sangat aktif di IB, baik di Sleman Tengah, Sleman Timur, cabang Sleman, kemudian sebagai pengurus harian PDI BDIY, Sekretaris Yayasan Bidan Sejahtera Yogyakarta, kemudian pengurus DPW MHKI DIY, kemudian pengurus harian LKBH Bidan Yogyakarta, dan anggota Komisi Etik Penelitian Kesehatan Fakultas Ilmu Kesehatan UNRIYO, serta anggota Vercap. Itulah CV pembicara hebat kita yang sangat aktif baik di bidang akademik maupun non-akademik. Baiklah, untuk ketentuan pada sesi ini, Ibu Dr. Istri Yuliani nanti menyampaikan materi selama 45 menit. Berikutnya tanya jawab selama 15 menit. Kemudian bagi peserta yang ingin bertanya, silahkan langsung untuk menuliskan pertanyaan pada kolom chat Zoom atau di YouTube dengan format nama dan asal serta pertanyaannya. Baik, selanjutnya kepada yang terhormat Dr. Istri Yuliani, SSIT MSc, dipersilahkan.
Thank you, Dr. Eko Mindarse, SSIT MKes. Good morning, ladies and gentlemen. In the last session, I would like to present complementary business opportunities in midwifery care. Most of the audience are Indonesia, so sometime I will present in bahasa Indonesia. I'm sorry, my English not good. Ya, baik para hadirin yang berbahagia, agar waktunya efektif, segera akan saya sampaikan materi tentang Complementary Business Opportunities in Midwifery Care. Baik, sebenarnya untuk materi saya yang di awal ini sudah banyak disampaikan oleh pemateri sebelumnya. Jadi barangkali ini akan saya sampaikan secara cepat untuk materi-materi saya yang di awal. Baik, segera kita mulai. Adalah tadi apa yang dimaksud complementary therapy atau apa terapi. Nah, di sini terapi komplementer memang dikenal dengan terapi tradisional yang digabungkan dalam pengobatan modern. Nah, komplementer adalah penggunaan terapi tradisional ke dalam pengobatan modern, seperti yang sudah disampaikan oleh pembicara dahulu. Nah, terapi komplementer atau alternatif di Indonesia saat ini banyak diminati oleh masyarakat pengguna ya di sini maupun oleh para profesional. Nah, di sini. Ya, selama 1 dekade ini memang sudah banyak praktisi kebidanan yang memberikan pelayanan kebidanan komplementer dengan mengkombinasikan pelayanan kebidanan konvensional dan komplementer serta telah menjadi bagian penting dari praktek kebidanan. Mohon maaf ya. Ya, jadi di sini karena yang diturut masyarakat itu adalah suatu kualitas dari suatu pelayanan kebidanan. Nah, siapa yang nggak senang seandainya pasien itu ditawarikan tambahan terapi komplementer. Misalnya ibu yang habis melahirkan atau ibu postpartum ya biasanya selalu merasakan ketidaknyamanan. Nah, oleh bidan diberikan aromaterapi misalnya. Nah, dia akan merasa lebih nyaman. Sehingga dia tentu saja akan merasa mendapatkan pelayanan yang lebih atau pelayanan yang berkualitas. Nah, mengapa terapi komplementer? Nah, di sini minat masyarakat terhadap terapi yang maksudnya pelayanan yang berkualitas tinggi. Hal ini menuntut adanya inovasi pelayanan kebidanan dan kreativitas dari bidan. Nah, karena bidan dapat mengembangkan kegiatan-kegiatan berbasis kreativitas dan inovasi yang dapat memenuhi kebutuhan klien, keluarga, dan masyarakat untuk kemajuan praktek profesi bidan. Namun demikian, bukan berarti layanan kebidanan dijadikan lahan bisnis yang profit maksudnya, akan tetapi penekanan pada bagaimana seorang bidan mampu berpikir kreatif, mampu berinovasi dan cakap dalam mengambil keputusan ataupun mengambil peluang dalam hal ini. Ya. Hal ini diharapkan dapat meningkatkan ekonomi dan juga memberikan peluang kerja bagi rekan-rekan bidan. Disinilah pentingnya ya bidan berinovasi. Karena apa? Ya, tugas bidan adalah memberikan pelayanan kesehatan ibu, pelayanan kesehatan anak, maupun kesehatan reproduksi serta keluarga berencana. Nah, fungsi bidan sebagai pemberi layanan kesehatan yang juga dapat dikembangkan sebagai social entrepreneur. Bidan memiliki peluang untuk mengembangkan bisnis atau usahanya sendiri di bidang asuhan kebidanan tanpa meninggalkan tugas pokoknya. Ya, artinya pelayanan kebidanan meskipun kita berorientasi bisnis, tetapi tetap ada muatan tentang kemanusiaan. Nah, salah satu bisnis di bidang kesehatan adalah bagi bidan itu khususnya ya adalah membuka praktek mandiri bidan. Nah, praktek mandiri bidan itu sama juga berwirausaha ya. Disinilah bidan dapat berinovasi dengan mengembangkan pelayanan kebidanan dengan melengkapi dengan asuhan kebidanan konvensional dengan asuhan kebidanan komplementer. Nah, di sini khususnya saya mengajak teman-teman bidan untuk menjadi bidanpreneurs. Nah, jadilah bidan yang mempunyai jiwa planner. Artinya bidan harus mengenali produk baru, membuat standar produk baru, membuat standar operating prosedur, memasarkan produk, dan bisa mengatur modal untuk operasional. Lebih lanjut ya, terapi komplementer dalam pelayanan kebidanan ya, kenapa sih penting? Ya, sampai sekarang ini angka kematian ibu masih di kisaran 305 per 100.000 kelahiran hidup atau 305 per 100,000 live birth. Nah, maternal mortality rate is an indicator of women health, indicated level of access, integrity, and effectiveness of health sector. Nah, ini artinya bidan sebagai ujung tombak pelayanan kebidanan atau lini terdepan dalam pelayanan kebidanan memiliki tugas mendampingi dan memberikan pelayanan kesehatan wanita dalam siklus reproduksinya sehingga berperan dalam menunjang penurunan angka kematian ibu tadi. Nah, untuk dapat melaksanakan tugasnya, bidan harus bermitra dengan perempuan, tidak hanya bentuk pelayanan asuhan tetapi harus pandai mengedukasi dan memberdayakan wanita dengan sebagai upaya promotif dan provokatif sehingga ibu memiliki kesadaran dan peran aktif menjaga kesehatannya. The practice of complementary therapy in midwifery care. Complementary therapy can be applied to complement conventional care. For example, in midwifery independent practice to reduce pregnant mother inconvenience, they can give aromatic therapy to reduce pain in maternity mother in ones. They can give counter pressure or abdominal lifting and so on. Complementary therapy can also produce special business, mom, baby, and baby spa, dan lain. Nah, di sini hanya sebagai contoh saja ya, beberapa terapi komplementer itu sebenarnya bisa ya di bisnis pun seperti yang tadi saya sampaikan, tetap harus memperhatikan muatan kemanusiaan. Penerapan terapi komplementer dalam asuhan kebidanan. Sebagaimana arti dari terapi komplementer Penerapan terapi komplementer dapat digunakan untuk melangki asuhan konvensional. Misal, pada praktek mandiri bidan, untuk mengurangi ketidaknyamanan pada ibu hamil, pada ibu bersalin, misalnya bisa diberikan aromaterapi. Untuk mengurangi nyeri pada kala 1, dapat dilakukan countervention ataupun abdominal lifting. Nah, kita lanjut terkait dengan peluang bisnis ataupun usaha layanan kebidanan komplementer. Entrepreneurship is a creative and innovative ability which can help and is sure to look for opportunity to success. The core of entrepreneurship is the ability to create something different by thinking creatively and innovative action to get opportunity. Approach used by business person to get opportunity in setting and new business is inside out approach, idea generation, and outside in approach, opportunity recognition. Nah, inside approach is approach based the idea that determine business success. Know your own skill, ability, background, and so on to determine kind of business initiative. The outset in approach is approach giving emphasis on the best idea that a business will be successful if a response or created the customer need. Nah, complementary midwifery care can be business opportunity for midwife, especially independent practice midwife. Nah, dari sini tadi di sini diperlukan bidan itu untuk berinovasi. Nah, bentuk-bentuk inovasi yang bisa dilaksanakan oleh seorang bidan misalnya adalah menciptakan sesuatu yang baru atau baik produk ataupun jasa. Bisa juga di sini extension. Dalam hal ini adalah mengembangkan produk atau jasa yang sudah ada. Nah, selanjutnya bisa juga duplication. Nah, tambahan usaha untuk tambahan usaha ini adalah misalkan untuk menyaingi yang sudah ada dan yang ditiru. Artinya di sini dari duplication itu kita pernah mencontoh suatu usaha dan saat ini kita harus bisa menyaingi usaha yang ditiru. Nah, selanjutnya juga bisa dengan sintesis. Nah, dalam hal ini adalah mengembangkan macam-macam gagasan yang sudah ada menjadi kondisi yang baru ya, seperti ini ya, karena inovasi sendiri itu artinya adalah cara untuk mengubah nilai dan kepuasan yang diperoleh konsumen yang berasal dari sumbernya. Jadi tidak sekedar memiliki gagasan, akan tetapi merupakan kombinasi keinginan menciptakan sesuatu yang cemerlang, disertai dengan kesungguhan untuk mewujudkannya. Disinilah letak dari inovasi. Tadi seperti yang tadi ada pendekatan inside out, ataupun pendekatan outside in. Ya, bisnis ataupun usaha layanan kebidanan komplementer. Beberapa hal yang saya tulis ini saya rasa tadi juga sudah disampaikan oleh pembicara terdahulu, yaitu tentang berbagai macam pijat ya. Pijat babi, pijat endorfin, pijat perineum, oksitosin, pijat payudara misalnya. Nah, kemudian ada hipnobirthing, hipnoterapi, akupressure, baik counter pressure teknik ataupun abdominal lifting, prenatal yoga, postnatal yoga, mom and baby spa, baby gym, pregnancy gymnastik, postpartum gymnastik, the use of herbal plant, the use of aromaterapi, dan masih banyak lagi beberapa layanan komplementer yang bisa mendukung dari pelayanan kebidanan. Nah, namun di dalam menjalankan bisnis tentu saja ada banyak hal yang harus diperhatikan ataupun ada beberapa kunci sukses dalam berbisnis ataupun berwirausaha. Di antaranya adalah ya kalau kita sudah mantap mau melaksanakan bisnis ya jangan takut gagal. Nah, kemudian harus dengan penuh semangat, kreatif dan inovatif, sabar, telaten ya. Dan juga harus tabah. Nah, dan harus optimis ya, terpenting dalam kita memulai suatu bisnis atau mengembangkan bisnis. Nah, kemudian juga membangun relasi dengan sesama bidan misalnya, ataupun dengan jejaring lainnya, atau wirausahawan yang lainnya misalnya. Ya, kemudian bertindak dengan penuh perhitungan. Nah, kemudian juga harus pantang menyerah. Nah, kemudian dalam berbisnis kita tetap harus berambisi atau ambisius. Nah, peka terhadap pasar. Kemudian berbisnis dengan standar etika. Itulah hal yang tidak boleh diabaikan. Nah, harus mandiri, jujur, peduli dengan lingkungan. Nah, mengapa ini akan tadi saya sampaikan, karena nanti bagaimana kita seharusnya dalam memulai bisnis agar bisnis kita berhasil, namun karena kita di bidang pelayanan kesehatan kita tidak mengesampingkan dari aspek kemanusiaan. Nah, upaya yang sebaiknya dipahami dalam bisnis atau usaha layanan kebidanan komplementer. Nah, untuk suatu pengelola jasa pelayanan kesehatan dalam hal ini layanan kebidanan yang bertujuan nirlaba. Nah, maksudnya yang ini yang bertujuan nirlaba pun diperlukan pengelola yang tahu tentang bisnis agar jasa layanan kesehatan itu dapat bertahan dan dapat memberikan dampak pada masyarakat yang menjadi sasaran. Pengelola usaha jasa pelayanan kebidanan ditunjuk untuk bisa dituntut, maksud saya untuk bisa mengkombinasikan pengembangan pengetahuan mengenai bidang kebidanan ataupun bidang kesehatan, tentunya di bidang kesehatan ibu dan anak, kesehatan reproduksi dengan kemampuan mengelola bisnis. Kemudian bidan sebagai pengelola bisnis ataupun usaha jasa layanan kebidanan harus pandai dalam merancang pendekatan atau penawaran pelayanan yang lebih lengkap sesuai dengan tuntutan dari pengguna jasa layanan kesehatan. Nah, selanjutnya bagaimana sih cara merancang bisnis? Nah, dalam layanan kebidanan komplementer yang baik, nah, merancang suatu bisnis tentu membutuhkan strategi, manajemen, dan sistem serta dukungan ataupun untuk mendukung dari tujuan bisnis yang dirancang. Salah satu model yang terbukti efektif dan sering digunakan atau diterapkan dalam suatu bisnis yaitu bisnis model kanvas. Nah, bisnis model kanvas ini adalah alat dalam strategi manajemen untuk menerjemahkan konsep konsumen, infrastruktur, dan keuangan perusahaan atau pengelola jasa dalam bentuk elemen visual. Ada 9 elemen dalam bisnis model kanvas, diantaranya adalah customer segment. Ya. Customer segment itu adalah siapa yang akan membeli produk kita, siapa yang akan mau membayar kita, misalnya seperti itu. Jadi kita itu adalah harus mempertimbangkan customer segmentnya itu siapa. Nah, yang kedua adalah value proposition. Nah, mengapa sih orang memilih untuk menggunakan produk ataupun jasa kita, misalnya apa sih keunggulan bisnis kita dibanding kompetitor yang lain. Nah, apa yang paling menarik dari model bisnis kita? Nah, inilah yang perlu kita rancang di dalam merancang suatu bisnis. Nah, kemudian yang ketiga adalah channel. Nah, bagaimana cara pelanggan dapat mengetahui produk atau jasa yang kita tawarkan? Bagaimana produk atau jasa bisa sampai ke tangan pelanggan? Apakah cara itu efektif? Nah, jadi yang sampaikan ini adalah rambu-rambu ya, agar untuk mencapai bisnis yang sukses. Untuk yang keempat adalah customer relationship. Nah, di sini bagaimana kita selalu connect dengan pelanggan dan bagaimana kita memastikan pelanggan kita itu puas setelah menggunakan produk atau jasa kita tentunya. Nah, ini juga harus kita perhatikan. Mohon maaf ya. Kemudian yang kelima adalah revenue stream. Bagaimana cara bisnis kita biar menghasilkan uang? Nah, apa saja produk atau jasa yang kita jual? Ya, seperti tadi sudah saya sampaikan, ternyata di dalam pelayanan kebidanan ataupun kita saat memberikan asuhan kebidanan, banyak hal yang bisa kita jual. Untuk yang selanjutnya, standar yang harus kita siapkan yaitu key activities. Key activities ini adalah merupakan kegiatan yang harus kita lakukan untuk menciptakan value atau nilai position. Nah, apa strategi bisnis kita yang kita lakukan sehingga target dari kita dapat tercapai, dari yang merancang bisnis tadi itu bisa tercapai. Kemudian untuk key resource, nah ini ada merupakan sumber daya utama yang harus kita miliki untuk menjalankan bisnis kita ini. Dan aset apa saja yang kita butuhkan agar bisnis dapat bersaing dengan bisnis serupa. Untuk elemen yang ke-9 yaitu key partner. Nah, siapa yang dapat mengerjakan hal kebutuhan pengelola jasa ini ataupun jasa kita di luar key activitiesnya. Siapa sih supplier atau vendor yang paling menentukan kesuksesan dari usaha bisnis yang kita rancang. Dan yang terakhir adalah cost structure ataupun di sini merupakan pengeluaran apa saja sih yang kita butuhkan untuk menjalankan model bisnis ini. Nah, komponen biasa apa saja yang dibutuhkan pada setiap elemen, baik itu key activities, key resource, dan channel misalnya. Nah, dalam hal ini di sini saya tampilkan 9 blok ya dalam merancang bisnis dengan bisnis model kanvas. Baik, nanti akan saya berikan contoh ya bagaimana kita merangsang bisnis model dengan model kanvas ini. Ya, ini saya ambil contoh dari bisnis yang sangat sederhana. Contohnya adalah ini BMC atau bisnis model kanvas pijat bayi. Kalau kita mau membuka pijat bayi, rancangan seperti apa sih yang harus kita siapkan? Seperti tadi yang saya sampaikan, ada 9 blok atau 9 elemen dari bisnis model kanvas itu. Ya. Untuk key partnership, tadi siapa sih yang akan membeli produk kita? Nah, misalkan key partnership adalah siapa yang akan menjadi partner ya maksud kita ya atau kebutuhan apa sih nanti yang bisa memenuhi kebutuhan kita. Nah, di sini misalnya ya tentu saja kalau kita mau bisnis pijat bayi kita butuh supplier minyak pijat. Tentu saja yang organik ya, yang baik. Kita perlu kader posyandu untuk nanti ikut mempromosikan. Dan kita juga perlu bekerja sama dengan dokter spesialis anak misalnya. Ya karena nanti beliau bisa menjadi konsultan. Kemudian untuk key activities-nya di sini adalah berarti untuk mendukung aktivitas yang akan kita kerjakan tentu saja kita harus ada minyak atau minyak pijat. Di samping itu kita juga membutuhkan APE misalnya sesuai dengan umur si bayi ataupun balita. Kemudian untuk key resources-nya adalah atau di sini artinya kita harus paling tidak menyediakan ruangan yang sesuai, yang nyaman misalnya. Juga harus ada petugas yang betul-betul kompeten. Jadi memang tidak mudah ya untuk bisa melaksanakan asuhan komplementer tentu saja harus melalui pelatihan agar kita menjadi praktisi yang benar-benar kompeten. Kemudian untuk value propositionnya ini di sini adalah diantaranya adalah produk bayi. Pijat bayi itu apa sih manfaatnya ya? Misalnya bisa memperlancar peredaran darah, meningkatkan kecerdasan, kemudian meningkatkan imunitas. Nah, kemudian bayi menjadi lebih rileks, bayi bisa tidur nyenyak. Nah, kemudian bisa berperan dalam menaikkan berat badan. Untuk di aspek selanjutnya ya terkait dengan customer relationship-nya. Bagaimana sih untuk menarik pelanggan? Nah, pastinya misalnya ada diskon. Nah, atau pada saat pasien datang ke tempat pelayanan kita berikan welcome drink. Ya, baik sesudah pelayanan maupun sebelum pelayanan kita tetap menyiapkan minuman misalnya seperti itu. Untuk blok selanjutnya atau elemen selanjutnya yaitu channel. Nah, untuk channel itu kita bisa memanfaatkan sosial media. Saat ini tidak sulit ya kita memanfaatkan berbagai macam channel, bisa dengan IG, Instagram ataupun Facebook, Twitter, WA dan lain sebagainya. Juga bisa dengan membuat papan nama misalnya seperti itu. Selanjutnya, blok selanjutnya yaitu cost structure. Ya, dalam cost structure ini kita perlu memikirkan gaji petugas, biaya marketing, kemudian untuk belanja minyak pijat misalnya, dan belanja bahan habis pakai lainnya. Nah, untuk aspek revenue stream ini kita tetap harus meningkatkan jumlah pelanggan dan kita bisa sambil menjual minyak pijat. Jadi kita membuka pelayanan pijat bayi itu selain kita memberikan pelayanan, kita juga bisa sambil menjual minyak pijatnya. Nah, tadi di dalam tadi BMC pijat Bagi atau bisnis model kanvas usaha membuka pelayanan pijat bayi, tentu saja customer segmennya adalah tadi bayi dan balita. Nah, inilah para audien, para hadirin yang bisa saya berikan contoh ataupun contoh sederhana dalam merancang suatu bisnis layanan kebidanan komplementer. Di sini saya mengambil tadi contoh adalah kalau kita membuka layanan pijat bayi. Baik, saya lanjutkan. Nah, sekarang terkait dengan marketing. Bagaimana sih strategi dari pemasaran atau marketing ya, marketing dari bisnis layanan kebidanan komplementer ini. Tentu saja kita harus bisa, yang pertama adalah membuat perubahan mindset dari masyarakat. Mindsetnya di sini kalau perlu kita harus membuat masyarakat itu merasa penting atau merasa membutuhkan dari layanan yang kita akan kita jual, istilahnya seperti ini, kasarnya seperti itu ya. Kemudian memberikan pelayanan yang terbaik. Nah, bagaimana kita memberikan pelayanan terbaik kepada konsumen atau pasien yang datang? Tentu kita mestinya dengan senyum, ramah, Ya kalau pasiennya tanya kita respon dengan baik dan tentu saja harus memberikan pelayanan dengan sepenuh hati. Nah kemudian menentukan target dari sasaran. Untuk sasaran ini penting kita analisis. Jadi siapa sih yang akan menjadi sasaran dari bisnis kita? Misalnya kelas menengah ataupun ke bawah atau ke atas. Ya, menengah ke bawah atau ke atas. Otomatis fasilitas yang kita siapkan harus sesuai dengan target sasaran kita. Nah, strategi selanjutnya yaitu kita harus saat ini ya di masa kita sudah semuanya menggunakan IT, tentu saja kita sebaiknya mempunyai website resmi tentu saja dari pengelola jasa ini. Tentu saja harus baiknya kita membuat website resmi. Maaf ya, ini sudah diingatkan, waktunya tinggal 5 menit. Ya, kita mempunyai website ini. Kemudian kita juga memanfaatkan media sosial seperti yang tadi saya sampaikan, strategi agar jasa kita itu dikenal oleh masyarakat. Nah, tentu saja gitu. Nah, selanjutnya yang terakhir adalah kita sekarang bisa dengan cara mengaktifkan click to call. Nah, saya juga sering gitu mencoba-coba kalau ada click to call suatu bisnis itu kita coba klik. Nah, untuk pelayanan kebidanan ini pun saat ini kita bisa memanfaatkan aplikasi click to call tersebut. Karena ini akan memudahkan masyarakat ya. Masyarakat tinggal klik saja, dia akan mendapatkan informasi dari pelayan ataupun jasa yang akan kita pasarkan. Nah, ini strateginya. Dan yang tidak kalah penting, yang pertama adalah kita harus memahami regulasi. Nah, regulasi terkait dengan bisnis komplementer ini, bagaimana aturannya, terkait dengan peraturan undang-undangannya, bagaimana perizinannya kita harus pahami juga agar bisnis kita bisa berjalan dengan baik dan betul-betul berhasil. Nah, strategi tadi harus didukung dengan hal-hal yang mendukung keberhasilan dalam bisnis layanan komplementer. Yang pertama adalah available and sustainable. Di sini artinya jenis pelayanan kebidanan seperti apa saja yang kita sediakan. Nah, itulah yang harus selalu ada dan siap setiap dibutuhkan. Artinya jangan sampai ada pasien datang tetapi ternyata layanannya enggak ada. Yang kedua adalah acceptable dan appropriate. Artinya ini harus dapat diterima dan wajar. Nah, tidak bertentangan dengan adat istiadat, dengan budaya ataupun keyakinan dari masyarakat. Nah, untuk selanjutnya hal-hal yang dapat mendukung yaitu accessible. Accessible ini artinya ya mudah didapat. Kemudian juga affordable, mudah dijangkau. Dari aspek biaya maupun dari aspek menuju ke akses dari layanan tersebut misalnya. Nah, kemudian pelayanan yang kita berikan harus bermutu atau kita memperhatikan kualitas. Nah, karena dapat memberikan kepuasan bagaimana. Pelayanan yang berkualitas akan memberikan kepuasan pada pelangganan kita. Nah, semua pelayanan yang berkualitas itu adalah tentu saja pelayanan yang memenuhi standar. Dan perlu kita sampaikan bahwa dalam berbisnis pun kita harus tetap mematuhi etika ya. Karena saat ini banyak yang kepingin laku tapi kadangkala kurang memperhatikan etika. Dalam usaha pelayanan kebidanan kita memang bersaing dengan usaha yang mengandung komersial kadang-kadang. Namun pelayanan kesehatan khususnya dalam pelayanan kebidanan ini tetap terikat dengan kepentingan kemanusiaan. Sehingga nilai komersial tetap dibebani dengan nilai kemanusiaan. Usaha pelayanan kesehatan mempunyai nilai lebih dari nilai komersial artinya. Ya, di sini saya sudah dilirak-lirik oleh Ibu moderator. Nah, kebetulan ini juga sudah selesai. That's all for my presentation. Thank for your attention. Thank for you, Dr. Eko Mindarse, SSIT MKes.
Baik, terima kasih Ibu Dr. Istri Yuliani, SSIT MSc yang telah memberikan materi dengan sangat menarik dan tentunya menginspirasi kita semua. Tiba waktunya kita untuk sesi tanya jawab. Bu Sukma, apakah sudah ada pertanyaan? Ada 2. Bu Istri?
Ya, baik. Baik. Ya, nanti oleh moderator atau bisa langsung saya jawab.
Dari Mbak Tias, Bu, dari Brebes, intinya apakah di bisnis komplementer ini ada regulasi di kebidanan begitu, terutama di Indonesia?
Baik, terima kasih atas pertanyaannya. Terkait dengan regulasi bisnis komplementer, sebenarnya tadi sudah saya sampaikan bahwa terapi komplementer ataupun layanan komplementer ini bisa include dalam pemberian layanan asuhan kebidanan. Dalam hal ini artinya adalah ini untuk meningkatkan kualitas dari layanan yang perbidanan yang kita sampaikan. Nah, tentu saja regulasi ini kita sudah ada, misalnya oleh bidan praktek mandiri itu tentu saja sudah memiliki surat izin praktek bidan. Jadi intinya untuk meningkatkan kualitas layanan kebidanan. Nah, regulasi yang perlu juga yaitu misalnya seperti ini. Bagi teman-teman bidan yang tidak membuka praktek mandiri bidan misalnya, itu pun bisa melaksanakan ataupun membuka bisnis asuhan komplementer atau pelayanan komplementer dengan berbagai macam layanan. Misalnya membuka mom and baby spa, membuka layanan hipnobirthing dan lain sebagainya. Nah, regulasi di sini pastinya berbeda dengan regulasi jika membuka praktek mandiri bidan dalam hal perizinan. Ya, pada umumnya ini untuk layanan yang seperti ini yang banyak juga dilakukan oleh teman-teman bidan yang bekerja di institusi pendidikan, itu pengajuan izinnya adalah melalui Dinas Pariwisata. Demikian barangkali yang bisa saya sampaikan kepada penanya. Terima kasih.
Baik, semoga bisa menjawab tadi dari jawaban dari Ibu narasumber. Ada lagi Bu Sukma? Cukup? Satu lagi. Baik, ini ada satu lagi Bu, dari Mbak Novika dari Yogyakarta. Bagaimana kami menentukan standar biaya pelayanan dari terapi komplementer yang kami berikan? Seperti itu Ibu.
Baik, terima kasih Saudari Novika atau Miss Novika terkait dengan pertanyaannya. Untuk menentukan standar biaya pelayanan dari terapi komplementer ini tentu saja kita dengan melihat di lingkungan ataupun di pasar kita. Seperti tadi saya sampaikan, misalnya segmen dari sasaran kita itu siapa? Kelas menengah ke atas kah? Atau kelas menengah ke bawah kah? Pastinya disesuaikan dengan kemampuan dari masyarakat yang menjadi sasaran kita. Kita tidak bisa menunjuk nominal. Akan tetapi, ataupun barangkali, tapi ini enggak pasti ya. Untuk layanan kebidanan sendiri sebenarnya itu di masing-masing wilayah itu sudah memiliki standar tersendiri yang diatur oleh Ikatan Bidan Indonesia. Misalnya ya, kalau di Jogja untuk bidan yang praktek di wilayah Kabupaten Sleman misalnya, itu untuk standar tarif pelayanan itu sudah ditentukan atau disepakati, ya, disepakati bersama-sama dengan pengurus Ikatan Bidan Indonesia. Ada standar minimal berapa. Nah, ini untuk standar biaya pelayanannya. Tapi berbeda ya dengan yang murni dengan berbisnis, misalnya hanya komplementer, pelayanan komplementer saja. Itu bisa juga kadang-kala kalau brand franchise itu ya, model franchise itu kan akan ditentukan oleh, nah dengan siapa kita berfranchise misalnya seperti itu. Tetapi kalau kita menentukan sendiri ya tentu saja harus kita sesuaikan dengan sasaran kita. Kelas menengah ke atas atau kelas menengah ke bawah. Artinya karena tadi sudah saya sampaikan bahwa salah satu hal yang mendukung keberhasilan dalam bisnis komplementer ini adalah affordable. Artinya mudah dijangkau ataupun selain dari akses menuju ke tempat pelayanan tapi juga dari aspek biaya. Demikian barangkali.
Baik. Terima kasih Ibu Dokter Istri karena mungkin sudah cukup waktunya untuk sesi kita, Ibu. Jadi terima kasih sekali dan semoga jawaban-jawaban yang disampaikan oleh Ibu narasumber bisa diterima dengan baik. Ladies and gentlemen, attendees of international webinar participants, that how we have completed the series of season 3. Sebelum sesi ini saya tutup, saya akan membacakan hasil atau kesimpulan dari seminar hari ini, yaitu betapa pentingnya terapi komplementer dalam kebidanan dan penerapan terapi komplementer dalam asuhan kebidanan dapat dijadikan sebagai bisnis khusus atau menjadi peluang meskipun tetap harus menerapkan sisi kemanusiaan dan usaha bagi bidan, utamanya bidan praktik mandiri dengan 9 elemen kanvas tadi. Ladies and gentlemen attendees of international webinar participants, I would like to thank the presenter and participant who have participated in this international webinar event. Hopeful the knowledge gained in this webinar can be useful and applied in everyday life. Thank you. I'm Eko Mindarsyih as the moderator. See you again at the next webinar activity. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Miss Eko and the Dr. Istri Juliani. Now, I will to announce the winner of International Paper Study Competition with the term Evidence-Based Practice in Midwifery Care with Complementary Therapy. You can see it on screen. The committee share screen, please. Oh yeah. I'm sorry. I forgot to give the certificate for our speakers today. Okay. Take a picture. Okay. Thank you, Dr. Istri Juliani, and see you on next event. Yes, I am repeat. Now I'll to announce the winner of International Paper Student Competition with the theme Evidence-Based Practice in Midwifery Care with Complementary Therapy. You can see it on screen. The committee, share screen, please. Okay. Yeah, warmest congratulations for your victory. Selamat untuk semua pemenang. Okay. The winner, number 1 is Vina Astika, Petang Asi Raya Midwifery Academy. The effectiveness of garlic extract on blood pressure reduction in pregnant women with hypertension. Congratulations. Number 2, Diva Nur Puspita Devi, University 11 Maret University. The title is Complementary Therapies in Midwifery Practice for Reducing Emesis Gravidarum. Number 3, Maria Rambu Rija Eda, Respati Yogyakarta University. The title is The Effect of Routine Objective Care plus Special Touch on Postpartum Depression Syndrome. Oke, sekali lagi selamat untuk seluruh pemenang kompetisi. Dan yang belum menang, jangan patah semangat. Next event, ikut lagi dan semoga bisa menang. Now we will have take a picture. So open your camera, please, to all participants. Okay, the committee, are you ready to take a picture? Oh yeah. To all participants, please open your camera and give me best smile for a take picture this event. Okay. There are 3 slides. Slide 1. 1, 2, 3. Sudah? All participants can open the camera. Okay, we can start. Yes, page 5. Next, halaman 6. Silahkan dibuka dan berikan senyuman termanis agar di dokumentasi terlihat cantik. Oke, next. Halaman 8. Next. Halaman 10. And the last, halaman 11, terakhir. Okay. Finish? Yes. Thank you. Before the event closes, please fill the link of post-test. The time given is 5 minutes. The committee share it in group chat. Post-test? The committee can share link post-test. Mrs. Henny, can you share it? Oke, link post-test sudah di-share di grup chat, silahkan diisi. Untuk post-test akan diberikan waktu pengisian sampai dengan jam 3. Gitu. Baik, nah, yang diisi nanti ada post-test dan evaluasi kegiatan ya, sebagai syarat untuk mendapatkan e-sertifikat. Okay, we come to the end of part of our event. I would like to say thank you for the speakers, for informative and interesting talk to audience and active participants. Hopefully, the information will be beneficial for everyone. Now, I want to give pantun to all of you. Please open your camera and microphone. Okay? Are you ready? And I hope you can say cakep if I end my words? Not yet. Okay, are you ready? Okay. Ikan sepat banyak duri. Repeat. I cannot hear very well. Ikan sepat banyak duri. Duri tajam menusuk jari. Saya pamit undur diri. Sampai bertemu di lain hari. Thank you so much, and I'm Kenik Sri Wahyuni. So thank you, and I'm sorry for banyak kesalahan dari saya. Kurang lebihnya mohon maaf. See you. Bye bye. Thank you.
I had dreamed of becoming a photographer.
My ambition is to become a nurse.
I imagine myself as an IT expert.
Dare to choose a place to initiate your study and start your journey as the beginning of hopes and dreams. Because a bright future comes with hope to strive for. It is definitely not easy to make it happen, but let's reach our goal together. You must have the biggest dream to explore the world, expanding your mind and horizon globally while holding the values of Indonesian cultural roots. Collaborating with universities from various countries, going to the highest level bravely, with advanced thought to realize universal vision. For that, we are here to listen, accompany, and bring you to be what you want. Being responsive to the environment, having social empathy, hunting a sense to reach out hope and becoming good human being. Because being an inspiration in kindness is an opportunity to grow and empower others. Spreading kindness is the key to the progress of a society. Making you part of the bright future by mastering technology in various fields, changing the world with knowledge, being creative and innovative, and becoming a person ready to be involved in change. Being open-minded and exploring self-potential to play a role in digital society and ready to work. Every step towards success has a deep meaning and makes you a stronger person. Optimism, confidence, and persistence are the keys to success. Fighting spirit and consistency in facing the challenges and obstacles make us confident in welcoming the future. Your success is our pride and commitment. Our real success is to make you and them smile. Be ready to realize your dreams, because we are Great UNRIYO